Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today.
We are KUAM-FM in Hagåtña, Guam. This is Guam's favorite, I-94.
Do it. Good morning, Guam. And thanks for joining us here. It's the KUAM News takeover of Guam's favorite I-94. 614. Of course, so many ways to reach out and touch us on the show here. We are live on the radio, 93.9 FM, Guam's favorite. Of course, streaming on the KUAM News app and at KUAM.com. Also live on Facebook for our KUAM News viewers. Good morning so much. Hang in there, guys. We got this as we start week 5. I believe it's week 5. I lost track. I'm just losing track. 6:15. Of course, also we're streaming an audio stream on Docomo Channel 10. And then at 8 a.m., we jump over to KUAM TV 11, where we'll go onto the TV and bring the show to even more viewers and listeners. And we'll also be joined by Lieutenant Governor Josh Tenorio to kick off our 8 o'clock hour. And there's a lot. Yeah, there's a lot going on. We've got a lot of guests. Dave Delasola's got your labor, PUA, and FPUC update. And we're going to be talking to just a bunch of different people. And then also discussing the testing and the trend with these positive results and what that may or may not mean. All of that is coming up right here on Containing COVID. But as we do every morning, we start with a deep dive into the day's COVID-19 news. And there's a lot of stuff that happened over the weekend. So from the KUAM News team, good morning, Sabrina Salas-Mantanani.
Hafaday, and good morning, everyone. According to the latest from the Joint Information Center, the release going out at 7:05 p.m. Yesterday, the Department of Public Health and Social Services tested only 9 individuals for COVID-19 on Sunday. 0 tested positive through public health and 9 tested negative. To date, 136 cases have been confirmed through COVID-19 testing. 5 deaths and 112 recoveries. Now, recovery means a patient is no longer considered infectious. According to U.S. Centers for Disease Control and Prevention, research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All remaining cases are in isolation. In news from the CNMI, Governor Ralph Torres and his COVID-19 task force announced that there is now 1 new confirmed COVID-19 case, bringing the total number of confirmed cases in the CNMI to 14. The new case of COVID-19 is a 57-year-old female. She is in stable condition and is safely isolated at Kanoa Resort. The case is being closely monitored by CHCC medical teams. CHCC has already initiated contact tracing for the most immediate contacts. Starting today, the military, along with the Center for Disease Control, will launch a study to examine the outbreak of COVID on the USS Theodore Roosevelt. Volunteers will reportedly undergo serology testing through blood samples and swabs. Navy Surgeon General Rear Admiral Bruce Gillingham says this is similar to outbreak investigations the CDC and public health professionals do around the world. He adds the results of this outbreak investigation will inform medical professionals to support better public health decisions for the ship. It will also advise the broader COVID-19 surveillance and mitigation strategy for the Roosevelt, the fleet, and our nation. And because we're doing this outbreak investigation with the CDC, the information gained will add to the growing body of public health knowledge about this virus so that we can better understand it and fight it. As of today, 94% of USS Theodore Roosevelt crew members have been tested for COVID-19, with 669 positive and 3,913 negative results. 4,065 sailors have moved ashore. 8 sailors assigned to the Roosevelt are at U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors remains in the intensive care unit for increased observation due to shortness of breath. There's still no specific time frame when we will reopen the island, but the governor joined her colleagues from the 50 states and territories in a conference call to hear President Trump's guidelines to open America again. The president outlined a 4-stage approach, which he made clear was strictly up to each individual governor to decide. Governor Lulian Guerrero says it will involve 4 stages of containment, suppression, mitigation, and the final step, recovery. For that, she has appointed a panel that will help her decide when the time is right. Here's more from her press conference when Nestor Lecanto and Adriana Cotero asked more about this recovery panel.
Can you tell us who might be some of the people on that, and is it going to be a bipartisan group? Because what it appears to be emerging in the states is that it's becoming a political question where one political party seems to be favoring reopening as soon as possible, while the other political party may be favoring delaying it until there's absolute certainty that the crisis has been conquered. And so I was wondering if you could elaborate on who is on your recovery panel and if that's going to be a bipartisan group.
Okay, so I don't know their political affiliation because that wasn't my criteria in getting our recovery panel. My criteria was more experts that could help me with good advice. So my lead person there is Dr. Ricky Hernandez, who is the deputy director for GITA. Then we have the chairman of GITA, David John, who is also the a very successful businessman. Then the president of Bank of Guam, Joaquin Cook, is on there also from the financial part of the business. Economist Joe Bradley is there. We all know Joe Bradley. He's been a very professional, very expert in the economy, and has a history with working within not just the government but the private sector. We have Christine Belletto, who's the chairwoman, I think, or president of the Chamber of Commerce. We have Holly, who is a board member of the Women's Chamber of Commerce. We have Talar Laguatnia, who's the president of the Guam Visitors Bureau. We have Dr. Mike Cruz, who is my Surgeon General and also the head of the Physicians Advisory Group. We have Dr. Thane Hancock, who is the epidemiologist from CDC here in Guam. I'm trying to think who else. Of course, my chief of staff, Tony Babalta, and the lieutenant governor.
Just going back to your recovery panel, I question if former Governor Carl Gutierrez, who is your chief economic advisor on international affairs, will he be used to assist with your economic recovery panel, as he has experience with disaster and crisis recovery?
Yes, I actually asked our chief of staff to loop in former Governor Carl Gutierrez, and he works very closely also with GITA and portion of GITA.
The Department of Revenue and Taxation has released its first batch of economic impact payments, which was paid for by local funds. The initial wave of checks is targeted towards individuals who had income of less than $10,000. Checks were transmitted to the Treasurer of Guam last week and were mailed out. To assist with social distancing at the island's post offices and banking institutions, of the approximate 6,800 checks which have been printed, 3,200 are in the mail, with the second batch slated for delivery in the next few days. Now, after the implementation plan is finalized, mass processing of EIP checks to our island's people should begin within a few weeks. Meanwhile, DRT announces that it has released its form, Economic Impact Payment for Non-Filers, which is the form to be used for the EIP program. You can find that form now on our website. The Guam Bankers Association, in the meantime, is collaborating to assist the community in check cashing in order to adhere to social distancing measures. As such, check cashing is allowed for non-customers at Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. Senator Sabina Perez has written to the acting commissioner of the Banking and Insurance Commission for further information from our local eligible lenders who facilitated the Paycheck Protection Program, that is the PPP, under the CARES Act. Based on a report filed on April 16 provided by the U.S. Small Business Administration, 508 Guam businesses and nonprofit organizations were able to secure more than $102 million in loans. She understands that it is within Daphne Shimizu's power as the Banking and Insurance Commissioner to request this information from local lenders who participated in the PPP, adding that she has also received numerous reports from local businesses who submitted their applications in the first few days of the PPP, provided the additional requirements as requested, told their application was in good order, and were later informed that their applications were never submitted to the SBA. PPP funding has since dried up, with applicants missing out on the opportunity of these loans to continue paying their employees during this pandemic. Here is Dana Bacchus.
Large flag-waving crowds lined the streets of Brookfield, Wisconsin Saturday to protest the governor's extended stay-at-home order. The so-called Liberate Wisconsin protest and others in several U.S. cities called for a restarting of the nation's economy. This week, President Trump unveiled a three-phase plan to reopen the country, leaving many of the details and decisions to governors. In his Friday coronavirus briefing, the president said he would like to resume large campaign events ahead of the November election.
I hope we're going to have rallies. I think they're going to be bigger than ever.
In New York State, where more than 235,000 people have tested positive for coronavirus, wearing a face covering in public is now mandatory when social distancing is not possible. Governor Andrew Cuomo says hospitalizations are still slowing, but warned that the state is still not in a good position.
We still have about 2,000 people yesterday who were new admissions to a hospital or new COVID diagnoses.
Boeing, which plans to restart some operations in Washington state in the days ahead, conducted its first COVID-19 transport mission. It flew a 737 jet from China with more than 500,000 medical-grade masks for healthcare workers in New Hampshire. While some states are gradually easing certain social distancing restrictions, California is keeping them in place as it deals with its highest death toll yet. Saturday night, Lady Gaga and a who's who of music legends hope to provide some relief in a global concert fundraiser, One World, Together at Home. Danya Backus, CBS News, Los Angeles.
Bicultural Association Guam chapter donated $500 to PPE for Guam. IBBA's mission is to promote bilingual bicultural activities in the Pacific Island areas of Guam, the CNMI, Palau, the Marshall Islands, Hawaii, American Samoa, and the FSM through the development of policies, dissemination of information, involvement of the community, and encouragement of quality education programs. So thank you to the members of PIBA.
All right, and thank you, Sabrina Salas, Matt Tonani. We're going to take a break and come back with more containing COVID right here on I-94. It's the KUAM News Takeover, Guam's favorite. Good morning on you.
Try McDonald's oven-baked apple pie, wrapped in a warm sugar glaze.
New self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mancinopia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Cool Ranch, or fiery. So when the next party comes around, you know which guy you're gonna be. The Variety Taco 12-pack, only at Taco Bell. Live Moss.
Johnny Fonte, the KUN News takeover of Guam's favorite. It's containing COVID, 633. A lot of discussion going on around the island about the number of tests that we've been doing over the weekend. Tested just 16 people, Sabrina.
I know, no explanation why. I mean,
really, that's kind of the.
I didn't see it in the release.
That's kind of the troubling part to me is they put out these numbers and. I don't know if they just don't know that the people of Guam are in the dark, or they just don't care, or they're waiting for the press conference to kind of discuss it. But, I think it was said Friday that people are not showing up to be tested.
Well, it's not like you can just walk in and get tested. And, I think it was Dr. Ho Win who said last week that there's a shortage, across the nation, but here on Guam, of the swabs.
Right, yeah. So it's not just the test kits, right? There's also things that they need to be able to run these tests that...
Because they have the capability to do testing at GMH, right, at GRMC. We've been waiting for the 4,000 or so test kits for the Gene Expert, which we've been hearing about now for 2 to 3 weeks.
Right.
And so...
And I think that's the thing, is that people of Guam are paying very close attention, frankly, because there's nothing else to do.
Mm-hmm.
So we're just laser focused on to you guys and not really getting the answers. I did some math myself. Not Peter Lombard level math. But from April 11th to current, we had run 188 tests with 5 positives and 1 death. Right. And so over the last 2 days, we only ran 16 tests. Friday, we ran 32, and that was a combination with different. So I don't know. I put something in the comments here. What do you guys think? Do you think that these 0 positives mean that we're doing a good job of flattening the curve, or do you still feel like I do that we're not doing enough testing? And I think it's almost a little dangerous to start talking about reopening the island when we haven't had that commitment to do the mass testing.
Yeah, well, you know, the governor did in her address over the weekend, that her daily address, mentioned that more testing is going to be conducted. I mean, obviously, we would hope, right, if we have all these machines. But, you know, I thought it was interesting in the CNMI how the governor there, Ralph Torres, announced that they just received 5,000 test kits. And I think these are the EUA, the Emergency Authorized Use Test Kits.
Right.
And then also received an Abbott ID Now machine. So they currently have the capability to run their own tests.
Right, and it's no more borrowing 5 tests from Guam.
Yeah, and was it Pohnpei? Pohnpei also now has the ability to run their own tests, and they're also going to be, I think FSM is going to be able to do theirs. Other islands,
right,
that would normally do their testing here.
Yeah, and so I guess that's what people are saying. We see in the comments, clearly I think the train of thought is that we're just not doing enough testing. And I don't get how the COVID-19 response team, how can you come out and say that we had 0 positives based on 9 test results with a straight face? How do you do that? I mean, because everyone is watching and they're all saying, when you say, why do we only do 9 tests? Why do we only do 7 tests?
Yeah.
But, you know, we've been talking to the doctors so much, and they all say that by this week, we're going to see an additional 200 tests being run. That's what they say.
Yeah.
So, yeah.
Well,
I mean,
I
it's
hope
not
so.
60,000 tests. It's not 5,000 tests. But, you know, and I was watching over the weekend some of the stuff that's going on in the CNMI with Tomas Maglonia, of course, our man of the CNMIs. They had a graphic that the CNMI governor's office and the COVID-19 response team came out with. And the graphic had, hey, here's the kinds of tests that we have. Yes, they're not, this one isn't FDA approved, but this is what we're going to use. It was very detailed information. And then there was a little part in there where it said, hey, if you've had any contact with anybody who's tested positive for COVID, you know, call this number. And I'm assuming that they're going to give that person a test. So over in the CNMI, and that's where we're really having this conversation, comparing what's happening here on Guam with what's going on in the CNMI, and I feel like Guam is coming up on the short end of the COVID stick.
You know, and also the governor there, he announced during his briefing, not even a press briefing, I'm talking about his Facebook post, but he announced that he's working with the CHCC, so I think this week or shortly, they're going to be doing what, you know, Dr. Cabrera has been doing with the trajectory. That's what it sounded like, to see where they are and what could happen in the next couple of months. So I'm actually really interested to see that. They haven't used those 60,000 test kits yet. I think they're still validating and calibrating and all of that. But so they do have, like I mentioned earlier, that Abbott ID, which we have.
Yeah.
And they received 5,000 test kits.
I don't know. I mean, I'm still trying to unpack in my head the whole resistance to using these South Korean tests. I mean, to me, it really just seems like it's something other than what they're saying it is. Because we've heard Dr. Cabrera come on here, and you know, the main argument that the governor and the Physicians Advisory Group is making is that, oh, these tests aren't FDA approved. But Dr.
All test
Cabrera,
kits, right? All test kits are not FDA approved. They just have the EUA, which the test kits we have are EUA approved. And even in CNMI, just those 5,000 test kits they received through the Abbott ID is...
It's a lot to keep track of. I don't know how you do it. But Dr. Cabrera basically said, yeah, the tests we're using right now are not FDA approved. So I'm not sure.
But they are EUA.
Right, yeah, I understand.
I just want to make sure everybody else understands.
Right, we're not saying that they bought them over at Green Hills or something, but... What? That's the impression they're trying to give it, like, hey. Okay, I'm kind of flying blind here, but we're going to say, I think we have, hold on a second. 94, good morning.
Hi.
Hi, Christina?
Yeah.
Okay,
Good
good.
morning,
Yes, good
Christina.
morning. Hey, we got Christina, of course. She's the mom of Jose, who was a sailor on the Roosevelt. First of all, good morning, Christina. We just wanted to kind of catch up with you.
Hi, good morning, and Bree. How are you guys?
We're hanging in there.
Yeah, we are. How are you? I wanted to touch base with you because I saw over the weekend they had a motorcade for the TR sailor who passed, and so I kind of thought of you, and I wanted to bring you onto the show and just touch base, find out how you're doing, find out what your boy's saying. So if you could indulge us.
We're good. He's good. He sends us daily pictures of his meals.
How's the food?
It's not Mama's food.
Definitely.
So that's what he keeps on saying. It's all right. It's not your food. I laugh at it though because it goes to a state of mind. If you know my son, then you know it's like, okay, he's good. He's good to go. He finally got tested. We're waiting.
Okay.
Speaking of testing,
yes,
I want to touch base. Sorry, Chris.
No, please do.
Your reaction.
That's what kind of why I brought you on too, is I noticed you were messaging me over the weekend, so I wanted to get your take on it too.
I'm gonna try and censor myself, but I'm perturbed. I am perturbed. I am irate. I'm livid. I do not understand how somebody that ran on a campaign of being a nurse and a health care provider can sit there and justify having tests run the way that and I know that she's not public health, and I know that public health is the one that's running it, but she has a say in it. And all of these people have that medical education and mentality, and they should know better. So why are they not running the tests that they have? If they know that they have so many coming in, 4,000 coming in, kill the ones that they have. Kill them now. Do them. Do the test. Run the test. Let people get a peace of mind. You know, my family was. I have one essential worker in my house, and we don't go anywhere. We don't do anything because we have a manumpo. So by extension, we are concerned that we're going to pass something to her. And it would be great if we could be tested. And I know there's a lot of households like that. A lot of households that just want to say, hey, you know what? I want to be able to say I don't have it. And yes, it's a very, what is the word I'm looking for? It's a small peace of mind, but it's peace of mind nonetheless. You know? Yes, I'm negative now, but I can be positive in a week from now. Okay, but I had that peace of mind for just a small moment. And I know how to keep myself safe and away from people if I do test positive. But if you have the test, why are you not using them? That is my biggest question. What is the gain from not using those tests that you already have? I've been reading in the comments, are they saving it for themselves? Are they saving it for their relatives? And I'm like, okay, don't think so negative. But it raises the question.
I think what's really missing in action here, Christina, is forward information. You know, we shouldn't have to be discussing this in the way that we're discussing it now. There's just a lot of uncertainty because there's a lack of, not only just a lack of information, I mean, they went dark the whole weekend. No press conference, no nothing. And so, while I understand that they might view these press conferences as, engaging the media, it's not really about that. The media is watching. Yeah, we're asking questions, but who's really watching is the public. People are tuning into these press conferences because they want to know what's going on. And so I think if we're going to put out 7 tests, 9 tests, then, don't insult our intelligence. Do not. I mean, we're some smart people out here. Mm-hmm. And when you run these numbers and you give us 0 positives. So we only ran 9 tests. I mean, it just doesn't add up in our minds, and we are just hungering for some type of explanation. Now, if it's that you don't have the test to do, then you got to come out and be honest with us. I mean, we've been hearing that they're going to increase testing capacity for a few weeks now. It hasn't materialized. That's all I'm saying is, like, if there's a problem, we understand. You guys could, look as good as you can by saying, oh, we're dealing with the same shortages, guys. That's what's happening. I know a lot of you are asking why we're running so few tests, but we don't get that. Instead, it's like, here they are. I mean, you can't call them, it's there's no real opportunity to find out why.
I just think that also, if you're going to announce that we've got all these testing capabilities, we've got this Avid ID here, over there, everywhere, and we're going to, by the end of the week, we should be able to do 100 tests next week, 200 tests, and then
I feel like they've been saying that a few
9
weeks now.
or whatever over the weekend. I just kind of makes me wonder what really is going on. Are we rationing them? And if we are, if there is a shortage, then just
Give
say
us
it.
a reason.
Yeah.
Exactly. If there is a reason why we're rationing it, let us know. So, hey, you know what? We have some peace of mind. Oh, okay.
Yeah, I mean, it's really pretty basic. People, we keep saying this, and we've been saying it since the beginning, is if you don't put some kind of information in that void, people are just going to fill it, and they're going to say, like, oh, you're saving the test for your relatives, or oh, look what people are saying.
And if you're going to announce I've got a recovery panel, and we're going to start gradually reopening things and this and that, then we should know where are we with these test kits and testing, because I would just think that the more you test, the more you know. And
I mean, but I think it's irresponsible to only test 16 people over a weekend, 7 people in a day, 9 people in a day, and then sit there and say, like, yeah, we're thinking about reopening because there hasn't been, and I think it was one of the senators who brought it up, was that there hasn't been the same amount of commitment in responding to this from the government of Guam that we're seeing on the people's end. Like, we're doing our part. Curfew, no curfew, tickets, you can't give us whatever. We're, for the most part, we are doing our part. We are staying home.
Ourselves.
So we're doing our end. I don't know why the government of Guam's not holding up their end of the bargain.
Unless they do have the information, and because they're making these sort of decisions and announcements that, we've got this recovery panel and we're going to start looking at whatever, then maybe they do know and they're just not telling everybody.
Yeah.
You know what I mean? I mean, I would hope that the decision that the administration, the governor, the surgeons, physicians advisory group, that they must know what they're doing, but they're just not, presenting it to the public.
Maybe we need
to where we would understand.
Another presentation, Bree.
I want to see another trajectory.
And then the other thing is like, if you want us to take this serious and stay home and stuff, you can't start talking about reopening the island and then expect us to still be jumping through all the little hoops. I mean, I am, because I fear for the safety of our people. I'm sold on this. I'm gonna wear a mask. I'm gonna do my part. I'm gonna stay home. Because I really believe that the risk is it's great out here, and I've never been someone who trusts the government, so this isn't just a COVID thing. But
until I see more tests being run, I'm going to stay home. I'm going to continue wearing my mask. But 7 tests, 9 tests, that's not cutting it for me.
Yeah, it's definitely not.
Yeah. My thing is, she has sat there and said that we're supposed to stay in. The second wave is coming. Don't be naive. We're going to see, the worst is still yet to come. And in the same breath, she's saying, oh yeah, we're thinking of reopening because there's 0 positives. You're giving us contradicting information, woman. Do you realize that in the same sentence? And I don't think that that's right. I don't think it's fair. I think you're giving us a false sense of hope. And I don't understand why you're doing that. It baffles me. It's very frustrating to listen to all of this. And I'm yelling at the TV. I'm yelling at my phone, whatever device I'm listening to all of this on. And I'm just like, you're making me mad.
Man, Christina, you're not the only one. I got a couple of friends who, before COVID, they wouldn't be the type to sit here and watch a press conference, because we're all caught up in our daily grind, going out there, you're working, paying the bills. But because we, have nothing else to do and people want to know what's going on, these couple of friends of mine, they've been watching the press conferences, but Friday they just had to turn it off because, like you said, they were just so angry. And like, there's a frustration. We don't feel like we know where we really are with COVID, and yet we're continuing to move forward with these discussions about, hey, are we going to reopen? Hey, are we going to do this? Are we going to soften restrictions? Which I understand is a conversation that, the media wants to know. Yeah, because it's happening nationally, so we want to know. But anyway, so.
Yeah. People want their lives back, and I get that. I understand that completely. But if, like you said, after everything opens, I'm staying away from everybody. I want to see what's going to happen. And if that second wave, like the Spanish flu, comes through, because I want me and my children at least to be safe. I know that sounds very, very selfish, but I can only police my own. I can only take care of my own and worry about my own. And I hope that the rest of the island does the same thing.
Well, I'm with you. I'm following the orders.
Yeah. Us too.
Yeah.
Well, Christina, thank you. Really, again, going back, so your boy's fine. He got tested. He's eating. He's still on the ship. Is there anything else you can tell us about maybe what he's saying that, the sailors are thinking about with this? There's a lot going on.
There is a lot of going on. Sailors get told it's a matter of a need-to-know basis. Yeah. And especially at my son's level, you don't need to know. Do your job. You have an order. You have a directive. Do your job. And that's what they have to do. Go to the gym. Okay, what am I doing at the gym? You're sitting here waiting until your days are up, and then get tested again. Oh, that's another point that I wanted to touch base on you, Chris. I noticed in your post that you said they aren't retesting the ones that have recovered.
Right.
Is that true?
That's what we understand. So according to the CDC guidelines, and we'll play, I think it's something on the JIC release, the CDC guidelines are...
they're classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared.
That's it. That's the whole criteria for, and this is a CDC guideline. So to be fair, our government is just following these CDC guidelines. But this is something that if you Google the national news, people who have recovered are testing positive again, and they don't know if it's because the virus is dormant or if it's that they're contracting it again. So the whole recovery science, it's still up in the air, which again is why I have, me personally, the government, they're the ones that know, but I just have a problem with this churning out these recovery numbers,
And there's 112 recoveries out of the 136 confirmed cases.
Right, and no one's saying we don't want to believe there's those recoveries, but I'm just saying if you look at the national, the international news, what constitutes someone who is recovered has been laid out by the CDC guidelines, but after that we're not really sure, and we're not testing these people.
Yeah, I was concerned about it because that, to my knowledge, that's what they're doing with the Navy in general, not just the ship, in general.
Right.
If you get tested positive, they quarantine you for, isolation for the 14 days. When you come out of it, you get tested again. If you're still positive, they send you back into isolation. And that's not just the ship. I have read that. I have heard it from other families that are in the Navy. So if they have all of these extra kits that are just laying around with their 4 machines now that can test, why aren't they testing the ones that have recovered? I understand CDC guidelines, but you're saving these tests for a reason. You're putting them in your pocket and saving them for a rainy day. You can't explain why to the public. So maybe the public can give you ideas of what to do with your test that you're putting in your pocket. Use it on the ones that have recovered to see if they are negative or positive still. If they're positive, put them back in. Even though they're not showing any symptoms, Hey, guess what? Since the beginning of all of this, everybody kept on saying, "Oh, stay inside, asymptomatic, asymptomatic. You won't show signs." It's frustrating. And then another thing. Oh my God, I'm going down a rabbit hole right now.
You're not
Like
the only
you
one,
said,
Christine.
I have time to think about all of this, and
Right.
I'm just,
Did you hear about the study that's going to be starting this week?
Which study?
There's a study that the military and the CDC, they're going to be doing with volunteers from, the sailors. So they're going to do these serology tests. I believe those are like the rapid test kits to determine, to study the outbreak on the Theodore Roosevelt, and then perhaps using the findings to look at the overall outbreak and how they can fight it.
Yeah. Well, that's only good to the public if we know the real, true result, And case study is case study. I get that. But case study can also be interpreted differently by different people. It's good because, like swine flu, we're getting Spanish flu, we're getting our information from there. And so, sorry, my cat is yelling. Can you get out of my room, please? I feel like one of those people on Zoom where their kids walk into the room.
Okay, Christina, sorry. Bree has to use the bathroom.
Okay.
I'm sorry. Okay.
Bye. You guys have a good day.
Thank you, Christina.
Take
You
care.
hang in there. You keep in touch. You got my number. You shoot me your thoughts. I like your perspective.
Hope everything goes okay with Jose.
Yes. Let us know, okay?
Okay. Bye.
Okay, stop. Okay, guys, we got to take a break. Sorry, I didn't mean to throw your bladder under the bus. It's 6:56. It's the KUAM News takeover of Guam's favorite I-94 containing COVID. Good morning.
Be healthy. Be informed with ITD.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Outfitting everybody, I'm Sabrina Salsmatinati.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social distancing. You know the drill. Wash your hands.
And stay home! Just stay home!
Stay home!
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Howdy everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your
And little throwback there, Angulina Kulosa. 7:05, we're KUAM FM, Agati, Guam. Hey, good morning to all of our Facebook Live viewers. Hey, and we're going to get Labor Director Dave Della Sola in just a few minutes. But first, we wanted to catch up with our Sin City correspondent, Mayor Robert Hoffman, who, Mayor's... Good morning, Mayor, first of all.
Good morning. Thank you for having me.
Our pleasure. So I guess you guys have been asking for the detailed information on the number of COVID positives by village. It was a rapidly evolving situation. Thursday, Friday, you guys had it. This info hit the island over the weekend. I guess we'll just start there. Can you kind of unpack for us what some of your constituents were saying and maybe what some of your colleagues were saying about people now having a better idea about COVID positives at the village level?
Sure. Well, on Wednesday, we started getting the information in saying that they're going to be start releasing the villages on Thursday. So we had to plan around a Thursday video call, and so that happened Thursday morning. And then during that meeting, a video call, there was concerns raised by mayors asking for more information that we wanted compiled. They said they're putting it together on a dashboard. And so they were able to kind of compile that, and they released, I guess, what they could to the public on Friday. I guess they said that's without violating anybody's HIPAA's rights or anything. They were to kind of give that to us, and it showed total numbers by villages. It showed the recoveries, and so, are we completely satisfied? No, some of us want more information. That's kind of always going to be that way. But for the rest of us, it's great to sigh of relief. But we did notice on the weekend, as mayors collectively, there was less people out. So that might have been something that, we figured that might have contributed to it, considering it was a payday weekend for some. So, but there were just generally less people on the road. So we were pretty happy about that. And we're going to continue to press on and ask for more transparency.
What other information are you guys trying to get, Mayor?
I think they wanted the villages of those that have died. That's one that was not included in that. And then the other was they do the homeless, where they're actually from on that end. So so we can, because there are a lot of homeless out there. But if they're homeless in one particular area, village park, we want that included in that area so that we can also figure out how to minister to them and take care of their needs, what their needs, if they have any, on that end. So that's something that we did ask for, and then we wanted more information on how they got it. Whether it be through functions or events or gatherings or whatsoever else. Some of it's very vague on it, but to have like six or I think they listed 6 or 7, but there was others. There were more flights because it's hard to say that 100 some were community transmitted, but how do they get it? And I think it would have been a better way to kind of list it out to saying, okay, these 117 may have got it this way, or but I think that'll also help flatten that curve by telling people, hey, it could have been got it at a store, or they got it at a restaurant, or from a delivery driver, or whatever else like that.
And I think it was Dededo Mayor Melissa Savaras who was saying that they wanted more information in terms of like, well, what neighborhoods, right, are the positive cases.
Yes, and that's the thing is that we're for the seniors, for the senior meals, for example, we're maxed out on the number. For Sinajano alone, we have like 126 deliveries that we do that. And, I went back and I said, okay, since you can't tell me who they are, here's the list. Why don't you delete the name who's not going to get a meal? And, or, just say that, hey, they're going to get a meal a different way. So at least we're lessening the potential exposure. It goes, oh, just keep doing what you're doing, though, take protective measures. And, but we're like, yeah, but the whole point of it is, we don't know that, the person could be in the house that is fully isolated and they're following the rules, but their family members have come into contact that way, and they're the ones coming out receiving the food. So there's potential exposure there, and then that one driver, that's not their only destination, so they're going to stop by 10 other houses. They may bring whatever to the next 10 houses. So it's very hard to kind of look at, and they don't see it our way. So we're just we're hoping that people are going to listen on that end. But I knew who the 4 for Sinajano were. I know they did follow the rules, and so I'm kind of very relieved that they've passed and they're now testing negative. But we wanted to see if there's any more, because I only knew of 4, so it's kind of like, okay, so there was only the 4. So
Well, it says 5.
I'm happy the residents trusted me to do that.
You had this Zoom briefing, the mayors and public health. That was Thursday, right? And then Wednesday you had a briefing with the governor. The mayors did, correct?
Yes.
Correct. Was there any discussion between either about mass testing?
We did ask for, that's something that we've been raising, asking how we go about it, and they rely a lot heavily on the physicians group and the resources that they're getting, and we get the same. These tests everyone's asking for tests. All the states were competing, so we did bring up the CNMI issue and saying, why don't we just take some of that batch from South Korea if they're giving, or other areas, other nations that call Guam a friendly area, and just use it and run the test. Put a positive actual corona into it and see if it tests positive and negative. And there's ways you can try to validate the tests, and any testing is going to be good. So but to rely a lot on the private sector is also very something that I don't know if people want to do that. Get in a car, go out there, get down, sit in the clinic and get swabbed, unless DSL and the other clinics want to do their drive-through testing, and then find
I don't know, Mayor. It's a public health emergency, so I feel like public health should be doing more. So is that kind of your assessment of how do you? We had this conversation the last hour. How do you digest the constant barrage of zero positives? I mean, do you think it's something that we can really believe in, or do you have questions about the number of tests we're doing, or maybe even the criteria and who they're testing?
I think it's criteria based. My wife and I were talking about it last night. I said maybe if they're only testing 9, maybe it's because those 9 exhibit some form of a symptom for it, and as these people either call the 311 hotline and say this is what I have, and the nurse refers them to get tested or not. But that could be one way. It's just they're not meeting the criteria. But I don't know if I don't think it's based on the availability of tests. But I'd like to give the benefit of the doubt that there's less people out there saying I think I have flu-like symptoms and all the other things that are associated with COVID, and so they're the ones being requested to get tested. But I know that when they test in the morning, the results come out in the evening. So I'm just glad it's coming out at least before 9 p.m. A couple of times it came after 11, and people wake up to the news and they're like, "What? I thought we were okay." And so, I think people want the news and the information while they're still awake.
And how critical you think it is for them to put this information out? I don't know, who is that person in Adelup or the governor's office or whatever with the COVID-19 response? Who's that person that says, hey, wait a second, you think if we put out that we only tested 9 people, maybe people are going to be like, hey, why'd you only test 9 people today? Why'd you only test 7 people yesterday? I wonder who that voice is, and if they're listening to that voice, or if there even is one.
I think they're the ones preparing it. I think it goes up to the lab. It's like I said, it's difficult to navigate to see who's calling the shots and what gets done. So I'm pretty sure it's somebody says how many are tested, then the lab prepares it, does the results, and says here it is, and then go make the press release, and they send it to another person who's not doing any of the stuff. So I think that's kind of where they only prepare what they get, and is there an ability for them to ask questions and say, give me more? I don't know.
All right, someone put a comment here. Almost sounds like the test is a cure for COVID.
No.
I think it's a cure for maybe us not knowing where the hell we're at with this thing.
Yeah, but I want more mass testing. I mean, if the federal government is shouldering the cost for the testing or whatever, I think if they're testing or the treatment, one of the two, then maybe the clinic should have the ability, if they can, because if the government only has X amount of tests, how does DSL and the other clinics have tests as well?
Well, we know.
What are they using?
Right, and we heard that they were doing the test, but then we also heard that it took 5 to 7 days, and we haven't seen that. I was assuming that in 5 to 7 days after them announcing that commercial testing open, that we would see, 200 tests taken, this many positives, but that shoe hasn't dropped yet, and I don't know why.
Yeah. And I think the clinics are just being cautious about having either exposure or figuring out a drive-through method.
Yeah, and this is, obviously a lot of people have questions about testing, but they had said Friday, people aren't presenting to us, and maybe they're getting stuck in your roadblock. You're telling people to stay home, but then you
So did they?
That might be.
When you asked about mass testing, did they tell you when they plan on rolling it out?
No, they didn't.
There's no timeline.
No timeline on that end. They're just, a lot of it was, how are we doing out there? Do we have enough protective gear as mayors? We're servicing the people. We're continuing to do our things. And so it's, we raised things, just general work issues with us, either our employees and exposure, and then also assistance that if they need. And so we stand ready to assist, but we still haven't gotten that call on that end. What else they need us to do?
Well, I understand that what also was discussed was what are we going to do? What are the plans for the homeless population? And Tamuning Mayor Luis Rivera, she was concerned, considering she does have quite amount of people that are homeless in her village, but there has been no plan other than we're still working on it, and Paseo might be a location that the administration is eyeing.
Yes, and that's correct. That's something that it was discussed about the homeless. They're figuring either containers, retrofitted containers to be put there, and then they're looking for the existing infrastructure. Some of the suggestions are why don't they use Tizen, and then airport police is there. It's easier to view, and there's not many tourists coming in, so maybe the airport police can do a little bit more. I don't know what their workload is, but I'm just saying that it could be something they can pull double duty for. But I think Paseo is one of the more desired locations, so I think that's in the works. I know that over the weekend they've been talking about that. I'm not sure who the lead on that is, but I know that is something. And then the other thing we did discuss is how to get disaster, I guess, as people apply for either labor or other types of assistance, is to do these points of distribution. So they're looking at mayor's offices for assistance in terms of copying needed documents which need to be submitted, looking for drop boxes. So that's one of the discussions we had, is how do we do this, remain safe, but at the same time, they can expect 45,000. They expect applications for all these other types of assistance, and so mayors are actively looking at how we can best do this, whether it be a north, central, south approach or just all 19, and how do we do it in a manner where you practice social distance. And a lot of these people that are probably going to apply for the assistance don't have the means to travel very far. So I think one of the things we are hoping is maybe all the mayor's offices. Right. So I know labor departments actually. So when you actually talk to Dave, that's something.
He's right on the line, yeah.
Yeah, so that was one of the snippets that we were looking at, is how do we go out and assist labor department in getting those information out, because some of these people would need computers to fill information out,
right,
and assistance, and we offered our facilities as mayors to help do that, to help our constituents.
Well, thank you, Mayor. I got to get Dave on the line because he's got a conference call, and I know there's a lot of people waiting for that PUA FPUC update.
Not a problem.
Those are just two acronyms I love stringing together. The PUA and the FPUC. Thank you, Mayor.
That's that.
Be safe.
Yeah, wash your hands.
Thank you.
Okay. There you go. Hey, I'm still washing my hands. Let's get Dave Della Sola, Labor Director. Good morning, Dave.
Good morning, Chris. Good morning, Sabrina.
Good morning.
I guess I know you've only got a little bit of time, so can you just update us from the last point that we talked, and what's new information, and how close or how much closer are we to our end goal, which is getting those checks in the hands of people?
Yes, well, we spent a lot of last week and continuously working with my team in trying to put together the implementation plan, looking at sites, trying to get all the infrastructure together. So that's starting to look promised. Today, in about 45 minutes, our software vendor is going to demonstrate the shell of what the PUA software is going to look like. And of course, I've explained to you that we're waiting for USDOL to give us the approved application, which they're trying to standardize so that we can make sure that all the fields are in that software. But like I said, they're moving forward based on their experience and standing up the software. So it'll be nice and exciting to see what this new software is going to do so we can start tweaking that. Then tomorrow I have a conference call, just Guam and USDOL, instead of the islands and region and all that stuff. So they're going to give us specialized training, and hopefully they'll have some, like I said, I'm just keeping my fingers crossed that they're going to release or give us some next step guidance, or we're still waiting for the agreement for the FPUC for that money after that was approved. So I'm moving as fast as I can with the information and the tools that they've given me so far, but I'm just waiting for them because I'm already surpassing them.
Are we still waiting on feedback on the $900 million supplemental budget request?
No, I'm putting the final touches on that.
Okay.
I'm waiting for the last bit of quotes, and I did hear a big piece of news that I know a lot of you guys have been asking me, and the fears that is this money going to be run out like the PPP program, or is this money going to dry up, or and I sent that question up all the way up to the assistant level, secretary level, and I got back that the sum for this program is, quote, is as needed or as appropriated. So there is no cap on the request for this program. So whatever is needed for this program nationwide, it moves. So we don't have to worry about funds drying up because we're delayed in getting our program started in the territories versus the state. That money will be there as needed, and that is what I always thought. But it was nice to hear directly from a fairly high senior USDOL official.
Well, Dave, we had Assistant Secretary Doug Domenech on the show a few days ago, and we also made the ask and told him how hard you're working, and if he could, somehow pull some strings or push some things, he said he would.
Great. I still push that from a higher level, and keep asking them to please hurry up and pass the things that we need so that we can move forward. And I mean, when I talked to some of these officials, they weren't real happy at the delay that USDOL is doing for the territories and for Guam. So I keep pushing that. I still keep the eye on that. And of course, last week we did get that dislocated worker grant for $1.5 million, and that was just like a small part of this grant. So there may be other parts coming. So this part is just for the recovery. So I can use this funds to bring people on to help out with the cleaning, the quarantine, the hospitals, wherever is needed to get us back to square one. So that's nice, and we look forward to. We just got the award letter, so we're looking forward to those funds getting loaded up when they get loaded.
Dave, what would you say to those people? I know last week we said, hey, get your docs together, sit tight. What would your message to those people be now, people who are waiting on these programs? Because I think it's important to get you on and let them know that whatever progress we're making, I appreciate that you're sharing it with us.
Well, yeah. Well, the first, like I mentioned this week, later on, I'm hoping to turn on the employer module full implementation, so that the employers can come in and load all the employee information of the layoffs, furloughs, and reductions. That is very critical for confirmation on these claimant applications. So that's what we're working on now. And of course, my hands are tied on the claimant side because I hadn't even gotten to look at what the applications look like. Mm-hmm. But as soon as we are able to get that application and finalize it, like I've mentioned to you, I plan on burning tens of thousands of copies and then distribute it out island-wide. You might not be able to apply or do anything, but at least you can get a hands-on copy, so you can start figuring out how to fill out each line item, and we can train and do PSAs on how to do this, so we can spend the next week or so telling you how to make sure that you fill it out properly. Mm-hmm. And that'll be a huge step, so that when we do turn on the system, that as much time and effort has gone into making sure that the application is done correctly.
Right. So for the time being, the onus is on businesses to register or file with the Department of Labor the number of furloughs and reduced hours, etc. This is at Hire Guam? Is this at HireGuam.com?
Yeah, Hire Guam, right now you register. I need to have you registered, establish an account, and then we verify you as a viable business. And then when we turn on the module later this week, I hope, and that's one of the things this meeting in a half hour, we'll get more guidance as far as when they're ready to turn the employer module on too. Then you go in and do your employee information. So just most of these businesses already have all the employee information ready.
Dave,
and layoff times.
Sorry, I had a comment here. How do we know if our employer has registered?
You don't. I will. I can start generating lists and stuff like that.
Oh, that's good.
And that's why we're making call outs. This will be a web-based online process. It's the register takes less than 10 minutes, and then to load the employees in there, it all depends, of course, on how big your business is. If you have 4 or 5 employees, I've seen parts of it. It's fairly simple. You just plug in fill in the blanks, and it'll guide you how to do each of the employees. So that is critical. I that's why it's I'm trying to get you guys to put the word out. We need to get all the employers, and they are, because we're getting about anywhere from 500 to 1,000 logging in and registering. So I can only hope and see what happens. It's the smaller ones that I need to make sure, because we're reaching out through the GHRA, the chamber, through GVB, and all those different committees to get the word out to these businesses. The smaller ones might be a little bit more of a challenge.
Dave, and so that question, I guess, how do we know if the employers are registering? We've also been telling the employees to kind of like lodge their info with you at Rapid Response at DOL. So you do have that, also the employee side information, right?
Yeah.
Okay.
Yes. Yes.
I got a message here.
Sure.
Go ahead, Dave.
I said, between the 311 and the rapid response, you should have most of your general questions answered. But we will be releasing. You have a lot of questions because we haven't gotten far enough from USDOL, and when I do, I will be putting that information out. So hang tight, and as soon as I learn it, I will go right out with you guys and tell the public and inform them.
You got it. I'll be standing by.
So just to recap, you're going to be having a teleconference with USDOL to find out if the application will. Wait.
Tomorrow is the recap with USDOL.
Okay.
And just to go over some of the elements of the PUA program, and of course I'll use that as a forum to get an update on where we're at as far as our FPUC, the $600 agreement. That needs to be sent to us, signed, so that we can put out a budget on that one. We will be giving out our budget probably tomorrow. We're waiting for the final quotes to be added in. Once I submitted, I wanted to make sure that we put in everything that we could put in on the programmatic side. As far as what we're asking to hand out, it's going to be close to just under 900, and then we're going to have a couple of million just on the program side, on running the program for the whole time. I want to make sure that we're complete and thorough with that request. And today's is with the software company.
And just so everybody knows, the wage or weekly benefit allotment, is that correct?
Yeah, the WBA.
Yeah. It's $345 for 39 weeks. That's for the PUA. And then the $600 for the FPUC. But that's only through July.
From April through July.
Right.
Okay.
So if you get laid off in March 15th, then that'll start your 39 week of the 345, and then through July, you'll get the added $600, and then after July, you will go back down to just the 345 until you expend all your 39 weeks, or you go back to work.
Okay. Dave, when you get that application, you'll shoot that over. Daphne had sent a doc over to us to put up on our social media for non-filers, and we got that out, a lot of downloads. So if you do, when you get that app, you send it over, and we'll put it up in a downloadable form for people to get.
Sounds like a plan.
Okay, Dave, thank you, man.
Thank you, too. I appreciate you getting the word out.
Of course.
Anytime.
Any way we can help, and wash your hands.
All right.
Okay, be safe.
Bye.
You too.
Okay. 7:32. Hey, we're doing our part. I'm telling everyone to wash their hands.
Yep.
That's Dave Della Sola, of course. Hey, coming up, we have Lieutenant Governor Josh Tenorio calling in at the top of the hour. Also on tap to hear from Ken Lujan from the Small Business Administration. And also Senator Sabina Perez, who wrote a letter about this paycheck protection thing.
That was interesting.
Yeah, I'm kind of curious, what was she getting at? Because I feel like she was definitely trying to get at something. So we'll get her on and figure that out. At 7:31, though, let's stick with the phones and let's get a federal presence on the radio with Frank Mansell from FEMA. Good morning, Frank.
Half a day.
Hi, Frank.
Hi.
So what's happening with FEMA? Any new supplies that arrived over the weekend or in the past 2 weeks since we last spoke?
Well, when did we last speak?
About 2 weeks ago.
It's been a minute, Frank, like the kids say.
What we've had is the initial order came in 2 Sundays ago, and that was air freighted in and landed at Anderson, and that was the first shipment of the strategic supply.
Mm-hmm.
And then we received another shipment probably about 2 weeks or a week and a half later, and we're just discerning whether that was part of the national strategic supply or if that was an order that was already placed. by the folks from Guam.
Mhm.
So we're sorting that out. But it is predominantly personal protective equipment, gloves, masks. It includes, I believe, some of the face masks that were promised by Apple. So there's a good enough supply right now of personal protective equipment, and we also have the ventilators that were shipped in the second order.
What about the FMS? Are we seeing anything moving on that? I know they were in the storage facility, and you were talking about how they were looking at bringing in another 50-bed FMS.
We're looking right now at availability of the third. We're working with the two right now as far as how to place them, where to place them. And a lot of that will depend on an assessment from something that the Corps of Engineers did last week. And we went out on Saturday, and we're going out this morning to take a tape measure to make sure that everything is going to fit.
Where were the assessments? I know that it was like 7 were done, and then you said now you guys did one over the weekend and another one today. Are they going to be at the same?
No, they're not. They're not new assessments. They're the short list. We just want to make sure that.
So you've narrowed it down from the 7.
Yeah. So what we've done is once we've got it to, the 2 that we're going with, you really have to send somebody out with a floor plan and map out where the beds are going to go, how much room there's going to be between beds. Is there going to be a line of sight for medical staff to keep an eye on more people? How are you going to get them in? How are you going to get them out? Where's the fresh water for cleaning? Things like that.
Were you part of
those are the details.
Were you part of the group? I think it was the Red Horse on Saturday. They were outside of the Guam Memorial Hospital conducting it looked like they were conducting an assessment for one of the alternate care facilities.
That I don't know. I wasn't aware of that.
Oh, okay. Yeah, I just saw the pictures that were posted that the National Guard was out. I think it was Saturday. So where are the these facilities going to be located?
Well, the 2 sites that they're located, that they're working with, and again, based on what the assessment is, what the Corps have said, they like I say, things are. You've got to take a tape measure to this, and is it going to work? So, as much as there's a punch list and an assessment done, you actually have somebody from the Federal Medical Station is on the island here, and she's going through and making sure that all of the details are looked after. So as much as the Corps team went in and did their punch list, there's some fine details that have to be looked at. So those sites, I don't want to give you those sites' names if they happen to come off.
But it started at 7. What did it narrow down to?
It's down to 2.
To 2 sites. Okay.
Frank, what can you tell us about?
Are they off base?
Yes.
Okay.
They are.
Yeah, I want to ask about the test kits. How involved are you guys in getting test kits out to the territories in the states? And are we getting any? Can you just give us an update on that?
Well, in this particular instance, all of the test kits are being ordered through Health and Human Services, and that's in coordination with the government of Guam. So anything that's being shipped would be done through that. This is a little bit different than the normal process in that Health and Human Services is involved directly with the government of Guam. I will have somebody back to you on exactly how many are ordered and how many are coming out.
And what's you guys' take on these South Korean test kits? There's been a lot of discussion about how valid they are.
And FEMA shipping these South Korean test kits to other locations.
The requests are coming from those other locations. So I know of nothing at this point coming this way from South Korea. I know that CNMI did order and received some.
Through FEMA?
60,000.
Yeah. Through FEMA?
No, that was
or?
direct. That was
Okay.
direct purchase from the government of Saipan.
Would they be reimbursed for something like that?
They believe it's a coverable charge.
They believe, meaning they're out on their own, or is that something that you guys agree with, or is it still
I mean, if
unresolved?
FEMA has shipped these same sort of test kits to states in the mainland, wouldn't that mean that they would be eligible for reimbursement?
Yeah, I believe that they would be comfortable in making that decision. You know, at the end of the day, there's always a possibility that it wouldn't be allowable, but given the circumstances, I'm sure the governor of CNMI made a decision with a great deal of confidence.
Right. So you're saying that all the governor of Guam has to do is ask for South Korean test kits, and then we probably get them, and that it would most likely be a reimbursable expense, and that we would spend on this maybe, and then get the money back down the line.
That would be something, first of all, that that's something that the governor would have to request. I don't know that the request would be denied. I doubt it.
So what's the deal with these South Korean tests, though, Frank? I mean, you would know. Are they legit or what?
I haven't even played a doctor on TV, so I can't tell you.
You could, though. You could.
If I stayed at the
maybe a veterinarian,
the Holiday Inn, I could.
I was just asking because I mean, how many miles up the ocean they got 60,000 of them, but we're sitting here testing 7 people a day. So I think it's a good ask,
Well, I think there are kits on the way, and I don't. I know there are kits on the way. I just need to know how many, and I'll have to talk to HHS and see exactly what's on its way.
And then what about?
It's not that you're out of kits.
Right. Yeah. It's just that we don't have 60,000 of them.
60,000 is a large number.
It is. Frank, what can you tell us about the FEMA trajectory? I know that Congressman Khalil Sablan out of the CNMI had posted what he said was the trajectory from FEMA for the, Guam and the CNMI. What can you tell us about that?
Well, the trajectory is something that's an evaluation that's ongoing all the time. And I think you saw it in D.C., where the initial trajectory was in the neighborhood of between 100 and 220,000. Then as more data came in, they fine-tuned that. And I think as this happens from territory to territory and state to state, as you get more accurate information, you redo the model and you look at different trajectories. We probably will be seeing a new model here in the next couple of days. So you want to right-size. Our goal is to work with the state to provide enough to meet the need, maybe exceed the need a little bit, but definitely not to hoard and call for everything based on the first model, because that first model is the worst-case scenario.
So how different is the model that we're going to see in the next couple of days, and how involved is FEMA in putting out that model? And is it something that they're doing in conjunction with, the governor's office? Or
Well, FEMA's not involved with that. All I know is that the folks at Johns Hopkins is working on a model. And like I say, if you work with spreadsheets or if you work with any modeling, if you introduce a variable and then you let the computer run it, then you've got, for instance, if the model says everybody wears masks, then you feed that into the computer and it comes out and says, well, this might be what's going on. Then you say everybody's social distancing, and then the model comes out with a new number. I think those numbers are going to come out here for Guam in the next couple of days.
Okay, well, that's something we want to anticipate. So thanks for that heads up.
Thanks for the heads up.
Yeah.
Well, I'm sorry we haven't got everything, but this is a number of moving pieces. And as much as you think you've got the answer, the target shifts a little bit.
It's rapidly evolving, Frank, is what we've heard.
Oh, okay.
I wanted to just clear up some things. So these alternate care facilities and the FMS, it's kind of the same thing?
No.
Okay.
They are two different things.
Okay.
Sometimes you can fit the FMS inside an alternate care facility. Sometimes you use the alternate care facility as a standalone unit, such as a hotel, and you would use the existing beds and modify the hotel rooms. That's not necessarily practical, depending on what the modeling says. Sometimes you have to do that.
So for Guam though, are we looking at alternate care facilities with an FMS inside?
Yeah, you're kind of looking at that.
Okay.
So
And
it's
right
very
now
much
it's two different sites. We've narrowed it
two
down.
different sites and two different FMSs. So the alternative care sites that we're looking at would involve bringing in the FMS and placing them within.
Okay, so 250-bed alternate care facilities.
And Frank, what would these facilities...
The 250-bed federal medical stations, and then the buildings that they're going into are going to be called alternate care facilities.
Got it.
And Frank...
with a third one on the way.
Third one is being assessed right now. And again, this goes back to the hoarding that I talked about. And
Okay.
that's not a proper word to use.
Okay.
You don't want to oversupply for the demand.
Right.
Like a panic buy.
Yeah, panic buy.
Yeah,
Okay.
so essentially we've got eyes on it, but I told you, up front, I'm not going to talk to you about, hypotheticals. I want to talk to you about what we have in hand.
Yeah.
Because that's the reality.
I was watching the press conference over the weekend with the Army Corps of Engineers General Todd Semonite, and he was talking about all these alternate care facilities that were going up across the country and contracts that were signed. Were any contracts signed with the government of Guam?
We have issued a mission assignment, and a mission assignment is a type of contract. And right now we're just waiting on, like I say, we're looking at the sites, and we have issued the contract, but we're just right now just want to make sure that the scope of work is accurate.
Frank, is that a public document? Is that something that we could get a copy of? Seems like it would be a public document.
I'll check on that.
Yeah.
Mission assignment, okay.
It's called a mission assignment, and generally that's covered under what's called direct federal assistance.
Right.
And that's a mechanism whereby we can sort of make things happen in a hurry.
Okay.
And Frank, with these alternate care FSM facilities, FMS.
Isn't that terrible? I'm sorry to have used
It's all right.
that
It's all right.
acronym.
Yeah. No, but so what type of services would be conducted at these sites? Would it be people just go in? They get
Is it for COVID or
Yeah.
non-COVID?
Yeah.
It would be for COVID, and it would be basically non-ICU COVID.
I see. And so would this include patients who exhibit symptoms or are also asymptomatic?
There you got me on the doctor question again.
Right. Well, because I'm assuming that we're standing these facilities up with the idea that somewhere down the road we're going to do some kind of mass testing that's going to require us to have these facilities in our inventory.
You should come work for us.
Man, how much you pay?
I had one more question. So we're going to stand up these alternate care facilities or field medical stations.
Yeah.
Who's going to man them?
They will be staffed by personnel that were also part of the mission assignment, but it's a different mission assignment. So the Corps of Engineers can't provide medical staff. So we're going to have to go through Health and Human Services or another federal agency to pull together the staff that will look after the the federal medical stations at the alternative care sites.
So we're looking at people from off-island flying in.
I would say so. I imagine the medical staff here are going to be pretty consumed.
Right.
Pretty much busy.
Okay. Frank, I think is that about it, Bree?
I know I'm missing a few things.
I know, but my bladder has only got about half a question in it. Still adjusting to the radio schedule again, Frank. Yeah. So appreciate it. I got your number. Wow, you put out a lot of new information for our listeners, so we thank you so much for that.
Yeah. Again, where were those two sites?
You gotta watch Bree. She's sneaky like that.
All right,
well,
thanks.
That's fine. I understand.
Yeah.
As soon as I can, I'll get that out to you.
And also the mission, was it mission statement? Mission assignment. Yeah, if that's a public document, I mean, if we could get a copy, I'd love to see that.
Yeah, mission assignments are normally they're prepared on the back row of you have what's called a response center,
right?
And there are usually 2 or 3 people, and that's their life during a disaster, and they just draw these up, and they sometimes change on the fly. Sometimes they I've seen them stroked, thrown out, and rewritten to suit the need.
Wow.
Our mission assignment, as I explained before, is basically we say, here's the goal. We want to feed 27,000 people. Go. And then we leave it up to them to do that and accomplish that the quickest way possible.
Okay. Well, thank you for the insight, Frank. Appreciate it.
Okay, very good. I'll get back to you on the availability of that document.
Yes. And wash your hands.
Twice a day.
Okay,
All
thank
right,
you.
take care.
All right.
Okay.
See you, 7:49. Hey, we're going to take a break. KUAM News Takeover, Guam's favorite. It's containing COVID. Good morning.
Stay home.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
A great show that was on Friday.
Definitely. Can't wait for this Friday's.
Oh, yeah, okay. So, heads up, local artists, be anticipating a call soon. I've already reached out, and we're all kind of working on this. Bree, can we get the latest results from the Joint Information Center?
Sure. According to the latest numbers from the Joint Information Center released at 7:05 last night, the Department of Public Health and Social Services tested only 9 individuals for COVID-19 on Sunday. 0 tested positive through public health. And again, 9 tested negative. There were no results released for the Guam Memorial Hospital, which does have testing capabilities. To date, 136 cases have been confirmed through COVID-19 testing, with 5 deaths and 112 recoveries. Recovery means a patient is no longer considered infectious. According to U.S. Centers for Disease Control and Prevention, research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. In the meantime, all remaining cases are in isolation. Those are the latest numbers.
Okay, 7:56. We're going to try and get an update, too, on the Roosevelt for you guys a little bit later on the show. Again, what we have on tap, Tomas Maglotnia, who's reporting on the CNMI COVID response, is going to call in, and we hear that they're already talking about implementing some type of community testing.
Wow.
Yeah,
so that means they, with the test
60,000
kits from the
test kits, yeah.
Wow. I know that they had the representative from Solgent there last week
Right.
going through the calibration or validation of the test kits. So that's...
It was also really interesting. For those of you guys just joining us, we got off the phone with Frank Mansell of FEMA, and there was a lot of new information that he had put out, Sabrina.
Right. So they started off last week, the Army Corps of Engineers. They did 7 site assessments for these alternate care facilities or field medical stations that they're going to be, they're actually looking at, again, 7 sites. And so today they're going over the final 2. They've narrowed down the list. He can't say where they are yet, but they are going to look at the 2. Well, actually, he said they were going to be building 2. Right?
Yeah.
He said 2 alternate care facilities, so these are the final 2.
And then they would have the field medical stations inside of them.
The alternate care facilities. And so the alternate care facilities are what the Army Corps of Engineers are building across the country. If they're not building them themselves, then they have contractors that they hired. And so when I was watching the press conference that the Army Corps of Engineers head, I think it's Todd Semonite, he held it over the weekend, and he's talking with media. And there was actually one of the reporters who asked about this curve and concerns, about curves across the country. And he did say that he's concerned about Guam, Hawaii, wherever there's an island. And so that's just something that they're looking at. I don't know if we're, whether we flatten the curve or whatever, but that's something that's on their radar. And so 2 alternate care facilities for Guam, and he mentioned the possibility of a 3rd FMS being sent to Guam, but they're kind of holding off on that because you don't want to, hoard.
Who would these facilities be staffed by?
He was talking about how off-island people would staff them, whoever HHS, Health and Human Services.
Yeah, that's good news.
Right.
Yeah. 7:58. Hey, we've got to go and flick the big switch to jump over to KUM TV 11. That's just in my mind a big switch. Okay, it's the KUM News takeover, Guam's favorite 994. So give us a minute here, and we'll come back looking purty on KUAM TV 11. It is KUAM FM in Hagatni, Guam. Good morning.
Listen to I-94 every Friday at 5 p.m. p.m. as we go live at the CS Coffee Shop in Agana. We're streaming on the KUAM News app and live on the I-94 Facebook page.
Don't forget weekly performance highlights on In the Mix Thursdays on KUAM Communications.
If you're a solo artist or a group who'd like to perform on Live Local Fridays, email Andy at KUAM.com.
Send us a message on I-94 FM's Instagram or Facebook. All ages welcome.
Live Local Fridays is brought to you by Burger King. Be your way.
Can you guess what the most common disabling disease is for people ages 15 to 49? It's migraine. Are you surprised? Show people with migraine some support by participating in Shades for Migraine, a fun awareness campaign from the Association of Migraine Disorders. If you know someone...
nos protegis l'animo.
Driving round, windows down, warm breeze and a soulful sound. I got my mind made up about where I wanna be. Can't nobody take my home from me. There is no place like
Oh, yeah.
home. Saying goodbye.
This is Bree's jam right here. She has a rough morning. She wakes up on the wrong side of the futon. I get this song on and it's all better. It's like audio.
good.
It's audio aloe vera for you.
And I
804.
need aloe vera. Like,
Yeah,
it's,
your hands.
It's cracking.
I feel like we should get like a dermatologist on to talk about. I keep washing my hands.
That's a good idea.
You're welcome. I'm getting the Halitai hands. Look at that. It's 8:04. Hey, welcome to the KUAM News takeover of containing COVID. Again, there are just so many ways to get the show. We're right here on the radio where it all started, 93.9 FM. Of course, streaming live on the KUAM News app and at KUAM.com. There's also an audio stream, Docomo Channel 10, and Facebook Live for our KUAM News Facebook family. Thank you guys so much for watching. Again, as we had FEMA Frank on, there's always some new information.
FEMA Frank.
What?
You said that on air, FEMA Frank.
That's what we call him. It's just easy point of reference. His name is Frank
Frank
Mansell,
Mansell,
but I call him FEMA Frank.
Yeah, it's kind of... Sorry, Frank.
Is that
Yeah,
unprofessional?
that's kind of like what we...
It is, okay. So
No, it's not.
Mr. Frank Mansell of FEMA, sir. So again, there's always real information, real time. So we ask you guys watch it, share it, get it out there, especially to other media, because some other media be asking me questions like, "Hey, watch the show and you'll figure it out." 806, and again, KUAM TV 11. We are now on the TV for the last half of the show. Definitely want to shout it out to our sponsors, IT&E and Calvo Enterprises. And let's move quickly here because I know he's a very busy guy. We got Lieutenant Governor Josh Tenorio on the line. Good morning, LT.
Good morning. How are you guys doing?
We're doing pretty good.
Are you going to learn? I was just thinking that maybe you should learn the dance move for that song.
Oh, for this one?
You can do on YouTube. Yeah.
Maybe just do it, and every morning, maybe.
No, Bree, stay ready. Bree, stay ready. I don't know. I think I might have to get some lessons from Congressman St. Nicholas when he does the Sina thing.
No, I think that'd be a different. You need a better teacher.
Boom!
Here we go. Let's do it. Monday. LT.
I'd choose Benji Santiago.
There you go.
Yeah, you can't go wrong with Uncle Benji, right?
Yeah.
807 LT. So I guess just we want to give you the floor. Let us know all the things that you guys are working on, and then we had some questions. So just go ahead, take it away, Lieutenant Governor Josh Tenorio.
Well, I just again thank you for the opportunity to come on the air, and I think the number one I think people are looking at is what's the where things on with all of the different relief packages, and so one thing I would like to say is that this payroll protection program that has just run out of funds, but it looks like the Congress is coming up with a negotiated agreement to push more money into SBA. But I can tell you that prior to closing the funding, there are already 508 employers that have received $102 million in grant funds from the SBA. Of course, 3/4 of this are there to provide payroll protection for employees. I don't have a list of the 508 employers. I'm not sure if I would have access to the list.
Yeah, I'm not sure if we want to read it either.
But I think that's one thing. And the other thing is there have been now 1,200 additional residents or households that have been approved for public assistance programs as of Friday. And
wow. Sorry, say that again. 1,200?
1,200 new households have been approved for public assistance programs.
Okay.
Not all of, and there's different, everything from MIP and Medicaid to food stamps. But there are now about more than 7,600 households that are now getting SNAP. So there's different things coming down. This morning and the next few days, we'll be keeping our eye on implementation for unemployment. And I know that they've been working over the weekend trying to get everything on board to get ready for that pipeline. And of course, last week, you know that there's more than $10 million that have been fronted for the rebates by Daphne Shimazu, and I heard she was on your show and letting you know about that a few days ago.
Right.
And in terms of the testing, I just have to say that there's a big nationwide, worldwide concern with testing, and I think that what's going on is people are in the medical group and at public health are working on a transition plan to expand testing. But I think one of the more, hot topics are, these PCR tests that do the nasal swabs that we've been relying on are in high demand. And then there are these new tests coming in from off island, or opportunities to get them in from off island that are not yet approved by the FDA. And I know there's a lot of reading and there's a lot of public discussion about that, but I just would say that the goal is to expand testing, and I think that over the next few days you'll see that there'll be some additional. We've received a couple of these new Abbott fast testing machines, with more in the pipeline, and so I guess we'll learn more about that in the next few days.
Is the issue that we have the machines, we just don't have the test kits? And
that's always been there's always big picture view, identifying all the test kits and the cartridges that are needed and timing them so that they're available for immediate use for the sickest of the residents coming in, and then made available for all of the different testing priorities. But I would expect that there's going to be expansion of or kind of a refresh of the testing priorities based on the kits over the next few days.
Right. Yeah, I was just kind of curious, why we were only seeing the 7 and the 9.
I think everybody's kind of wondering that. LT, what would you say to that?
That part of that is we're in the middle of expanding testing. So the testing protocols that were developed in consultation with CDC and HHS based on the supplies were there, and now that we're seeing a very optimistic signs, some of the optimistic measures that we see and we track every day are the number of hospitalizations and the number of recoveries. And I think that since last week, the governor has asked the physicians group and public health to do a pivot, and based on the stock that we have and the stock confirmed to be in the pipeline, to make that expansion.
So it's not just test results that we're looking at to determine how we're doing. We're taking into consideration the hospitalizations and the recoveries. And that all plays a factor.
The hospitalizations in particular, and the number of people that are in different levels of care. And I'll just maybe I'll say that some of the other things going on is there's been a movement of patients around so that we continue to be able to move and respond to more patients if another wave comes. And we're hopeful that another wave does not come based on the science and based on trying to make sure we reduce the amount of the potentiality for community spread. But I would just say that I would, looking at this the last few days, I'm very cautiously optimistic, but I also realize that this is also a critical time. You know how it is when in all sorts of things in life, things look great and you start doing things and all of a sudden you get hit. And I'm always leery that we need to just be very cautious, but keep moving to try and expand testing capacity, but then also look at incremental ways that we could try and return life to, the new reality that we'll probably find ourselves.
Are you aware of how soon we're going to see these alternate care facilities go up?
Well, there's actually a wave or a plan. So what happens is that there are I think there are 4 or 5 stages, and everything, and the trigger point will always be 80% occupancy of whatever system they're in. So, for example, if we're already at 80% capacity at Guam Memorial Hospital, including the skilled nursing unit of active COVID patients, then a next phase will come in, and those phases include, using the surgery center, and then further down 3, 4, there are always plans to respond to what the reality is. So they're all triggers that are in place, and then they're all coordinated between us and our federal partners and U.S. Army Corps of Engineers, the National Guard. But really, all of these stages are developed by our medical group, which, as you know, is being led by Dr. Mike Cruz.
So we understand that 7 site assessments were conducted, and so the final 2 have been selected. Where exactly are these alternate care facilities going to be located?
Well, alternate care facilities, later stages. I think that they're finalizing the action report, because part of these also include stepping up of some military assets, and in the next few days, and those would preempt having to utilize some of the other areas out there. But I tell you what, Sabrina, I would feel more comfortable having that come out from the surgery group, because, as you know, things can change in 24 hours, and I want to make sure it's accurate.
Yeah, because I had seen the representatives from the 254th, the Red Horse Squadron. I saw the pictures that they were over at the Guam Memorial Hospital just over the past weekend, and I was wondering if you had any information about that.
Well, part of that is I know that at least over there, do you recall, or if either one of you have covered some of the press conferences, or on the top floor of the hospital, there's a large classroom, and that basically is, what they've been doing is they've been assessing and maximizing the use of all spaces. So it's probably meant for taking a look at that top floor and converting, and the plans to convert into a ward, things like that.
Oh, they were actually outside, and they had their little measurement things.
Looking at parking lot.
Yeah.
Probably. Yeah. So their parking lots have been looked at to see whether or not for fitting for capacity of emergency medical assets, like mobile hospital. And you recall back in Typhoon Pangsangwa, there actually was a military field hospital on the parking lot of GMH when GMH was severely damaged. So those are all kind of like all the big picture pieces, and like I said, they're trigger points. And then I'll speak to the medical group in a few minutes and see where they are, and then find out when they would give an update to you guys in the next few days once everything is finalized.
Okay, what about...
the bottom line, I think, is that it's making sure that we have capacity, making sure that if we need to identify or order equipment, that's already ordered, and we're ready to move in case things turn for the worse.
What about the homeless population and addressing where they're going to be located? We haven't heard a whole lot about it from the administration for several weeks now, and I know that the mayors, they spoke with the governor through a Zoom conference last week, and they're not quite sure when exactly they're going to see this temporary facility. There's talk about it possibly being at Paseo. Is there any new information?
Yeah, so the Red Horse Squadron of the Guam Air National Guard have been out there doing their and have been basically coming up with a plan, an actionable plan that is currently in progress to make improvements, or I guess repairs, to shower facilities, making sure that they come up with a very good management plan. In the last few weeks, And definitely in the last week, there's been work being done by Gurus Ray Tapasnia with the Homeless Coalition and the private sector partners to identify, the method. There are 4 nonprofits right now that get regularly about $1 million in homeless feeding and emergency shelter monies. And the instruction from the feds were to use those pipelines or integrate those pipelines, and what the response was. And, several weeks ago, we thought that we could probably just open real quickly a congregate facility, and then seeing some of the problems that have occurred in some of the bigger states when they've done that, it had us really put a pause. But I would just say that that's a big priority. A lot of work. There's a committee working on that right now, and I think that they'll probably give us an update on strategy and their operations plans today. And I'm pretty certain the governor will be giving an update over the next few days on that. There's big pressure to get that open, but making sure it's done the right way.
Right.
So what's been the holdup? Is it
Does
just
it have
federal?
anything to do with the reimbursableness of it, or are we just trying to stand up?
No, it's just trying to make sure that we have the proper place and that we have the manpower to open it. So some challenges have been, not having the capacity to operate that while we're concurrently operating quarantine and isolation. And now that we're seeing, good progress with recoveries, including snail's pace or trickling in of the number of inbound passengers through the airport, we're able to really go in and utilize the resources to come up with a proper plan. And I think we're going to be very aggressive in the early part of this, but seeing some of the problems happening in the states, including where they inadvertently created a whole bunch of clusters in some of the states, and trying to make sure that we don't get into that same position.
Okay. LT, I guess, Bree, you got anything else?
I don't know. Is there anything else, Josh?
He's like, no, there's nothing else.
But it's not our last time, so,
Yeah.
I mean, I'm glad that I'm going to be working, on speaking with you guys a lot more. And
nice.
Looking forward to your continued coverage. And just wishing I just like to mention to the kids and the parents that today, it's not your competition, but it's public television. DOE has collaborated with us to bring some school lessons to the kids using TV.
Yeah.
And I think that one of the new realities is trying to really revise what the strategy will be for educating our kids, and maybe giving some tools for everybody that's at home. I know that it gets stressful sometimes, but somebody said, I'm always one of the optimistic people, as I told you, it's your time to hang out with your kids, and really try.
Usually the people who say that don't have kids, though. And they say it like that. They're like, yeah, hey, you can spend time with your kids. Yeah, you come spend time with them, bro. Drive me crazy.
I was on the phone with my sister's son, Dylan, very close to, and I was asking him, I said, Dylan, are you going to get your suitcase and come to my house and move with me? And he told me, he said, no, after the COVID. I said, after the COVID, you're going to move with me? He goes, no, I'll visit you. I don't want to move out.
Right.
Gosh.
Okay, I hate to, I know we're talking all nice and stuff, but I wanted to follow up on something because I did remember. It had to do with when we last talked about the Department of Corrections. Yeah. And the release of pretrial detainees. Then later on, we heard that there were the book and release and notice to appear that the AG was and their prosecutors were approving. So what is the latest with the Department of Corrections?
Well, I don't really have much latest except that, there was when CDC had been up there already, and Public Health has been up there doing their surveillance work because of the corrections officer that had tested positive. And we're fortunate that, at least as of right now, a little bit before 8:30, I've not gotten any reports or concerns about any causes for concern with the detainee or inmate population. But I'll just go back and say that always prosecutors, police, judges, they have to use their discretion to make decisions on release. And, you know, if somebody is chronically involved in the system and does violence, then I don't think that they deserve to be released. It really should be, and maybe one of the things that we can move to after all of this is detentions really should be based on what the public safety threat to the community is. There's a lot of different systems in place. We're definitely not there yet, but I'd like to get us there. I would just ask the prosecutors and police be very careful, you know, take a look at the backgrounds of folks. And, you know, at this time when people are at home and on edge, they don't need to be worrying about additional crime in their homes.
Thank you.
Yeah.
You know, that's basically what it is.
Yep.
All right.
Okay. That, you're
Well,
good
thank
now?
you guys.
Yes.
Thank you,
LT.
Josh.
Okay, talk with you soon.
Wash your hands.
Be safe.
Yeah, wash your hands and don't kiss anybody.
Okay, thanks. 8:25, Lieutenant Governor Josh Tenorio. Yeah, so the commitment has been made. He'll be calling in every Monday. So you guys got any questions that you got or you want us to follow up on, you know, please put that in. I think he kind of hit all the bases there. Talked about FEMA.
Testing.
And the testing
A little bit
and
about DOC.
what their idea and what their plan is for mass testing.
And homeless population.
And the homeless population, right. So it's 8:26. We'll take a little break, and then let's hop on our KUAM Imaginary Airlines and go up to the CNMI and catch up with Tomas Manglotnia. Again, it's the KUAM News Takeover, Guam's favorite I-94. Good morning.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Howdy, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
EU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Take Me Back, Love and Off a Day. Good morning. Yeah, we really try and promote the local music. So easy to do because it's awesome. That's all you'll hear throughout the show. It's all local music. Anytime you hear a song here, it's going to be local. If it's not local, that means I messed up. Okay, so call me out. 8:31. Hey, we're going to deep dive into the day's COVID-19 news. Good morning on you. Thanks for listening. KUAM FM 93.9. Of course, the KUAM News Facebook Live feed. We're also streaming Docomo Channel 10. That's an audio stream. We're on the KUAM News app. And also on KUAM TV 11 from 8 to 10 a.m. Good morning, Guam. And thanks for watching. We ask again that you share the show. There's been a lot of new information to come out this morning, both from Lieutenant Governor Josh Tenorio and Frank Mansell of FEMA. And let's get to it right now. I'll do a deep dive into the day's COVID-19 news from the KUAM News team. Good morning, Sabrina Salas-Matanati.
Off a day and good morning, everybody. According to the latest from the Joint Information Center, their latest numbers released at 7:05 Sunday night. Public Health tested only 9 individuals for COVID-19 Sunday. 0 tested positive through Public Health and 9 tested negative. There were no results from the Guam Memorial Hospital, which does have testing capability. To date, 136 cases have been confirmed through COVID-19, with 5 deaths and 112 recoveries. Recovery means a patient is no longer considered infectious. According to U.S. Centers for Disease Control and Prevention research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All remaining cases are in isolation. As for the latest from the CNMI, they have 1 new confirmed case, bringing the total number to 14 confirmed cases in Saipan. Starting today, the military, along with the Center for Disease Control, will launch a study to examine the outbreak of COVID on the USS Theodore Roosevelt. Volunteers will reportedly undergo serology testing through blood samples and swabs. Navy Surgeon General Rear Admiral Bruce Gillingham says this is similar to outbreak investigations the CDC and public health professionals do around the world. He adds the results of the outbreak investigation will inform medical professionals to support better public health decisions for the ship. It will also provide the broader COVID-19 surveillance and mitigation strategies for the Theodore Roosevelt, the fleet, and our nation. And because we're doing this outbreak investigation with the CDC, the information gained will add to the growing body of public health knowledge about this virus so that we can better understand it and fight it. As of today, 94% of USS Theodore Roosevelt crew members have been tested for COVID-19, with 669 positive and 3,913 negative results. 4,065 sailors have moved ashore. 8 sailors assigned to the USS Theodore Roosevelt are at Naval Hospital Guam being treated for COVID-19 symptoms. 1 of those sailors is in the intensive care unit for increased observation due to shortness of breath. There's still no specific time frame for when we will reopen the island, but the governor joined her colleagues from the 50 states and territories in a conference call to hear President Trump's guidelines to open America again. The president outlined a 4-stage approach, which he made clear was strictly up to each individual governor to decide. Governor Lilian Guerrero says it will involve 4 stages of containment, suppression, mitigation, and the final step, recovery. For that, she has appointed a panel that will help her decide when the time is right. Here's more from her press conference Friday when Nestor Lecanto and Adriana Cotero asked more about this recovery panel.
Can you tell us who might be some of the people on that, and is it going to be a bipartisan group? Because what it appears to be emerging in the States is that it's becoming a political question where one political party seems to be favoring reopening as soon as possible, while the other political party may be favoring delaying it until there's absolute certainty that the crisis has been conquered. And so I was wondering if you could elaborate on who is on your recovery panel and if that's going to be a bipartisan group.
Okay, so I don't know their political affiliation because that wasn't my criteria in getting our recovery panel. My criteria was more experts that could help me with good advice. So my lead person there is Dr. Ricky Hernandez, who is the deputy director for GITA. Then we have the chairman of GITA, David John, who is also the a very successful businessman. Then the president of Bank of Guam, Joaquin Cook, is on there also from the financial part of the business. Economist Joe Bradley is there. We all know Joe Bradley. He's been a very professional, very expert in the economy, and has a history with working within not just the government but the private sector. We have Christine Belletto, who's the chairwoman, I think, or president of the Chamber of Commerce. We have Holly, who is a board member of the Women's Chamber of Commerce. We have Talar Laguatnia, who's the president of the Guam Visitors Bureau. We have Dr. Mike Cruz, who is my Surgeon General and also the head of the Physicians Advisory Group. We have Dr. Thane Hancock, who is the epidemiologist from CDC here in Guam. I'm trying to think who else. Of course, my chief of staff, Tony Babalta, and the lieutenant governor.
Just going back to your recovery panel, I question if former Governor Carl Gutierrez, who is your chief economic advisor on international affairs, will he be used to assist with your economic recovery panel, as he has experience with disaster and crisis recovery?
Yes, I actually asked our chief of staff to loop in former Governor Carl Gutierrez, and he works very closely also with GITA and with the chair of GITA, and also with the business development portion of GITA.
Revenue and Taxation announces that it has released its first batch of economic impact payments, which was paid for by local funds. The initial wave of checks is targeted toward individuals who filed and had income less than $10,000. Checks were transmitted to the Treasurer of Guam, and they were mailed out last week. So if you didn't get it over the weekend, you should be getting a check in the mail today. Now, to assist with social distancing at the island's post offices and banking institutions, of the approximate 6,800 checks which were printed, 3,200 are in the mail, with the second batch slated for delivery in the next few days. Now, after the implementation plan is finalized, mass processing of the remaining checks to our island people should begin within a few weeks. Meantime, Rev and Tax announces that it has released its form, its economic impact payment for non-filers. This is the form to be used for the stimulus program for those Guam residents who did not file taxes. You can find that form on our website. The Guam Bankers Association, in the meantime, is collaborating to assist community in check cashing in order to adhere to social distancing measures. As such, check cashing is allowed for non-customers at the following institutions: the Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. Elsewhere, Senator Sabina Perez has written to the acting commissioner of the Banking and Insurance Commission, Reverend Tax Director Daphne Shimizu. She is writing to request further information from our local eligible lenders who facilitated the Paycheck Protection Program, or PPP. Based on a April 16th report provided by the U.S. Small Business Administration, 508 Guam businesses and nonprofit organizations were able to secure more than $102 million in loans. She understands it is within Shimizu's power as the commissioner to request this information from local lenders who participated in the PPP. She also says that she's received numerous reports from local small businesses who submitted their applications in the first few days of the PPP, provided the additional requirements as requested, told their application was in good order, and were later informed that their applications were never submitted to the SBA. PPP funding has since dried up, with applicants missing out on the opportunity of these loans to continue paying their employees during this pandemic. And with national news, here's Dana Bacchus.
Large flag-waving crowds lined the streets of Brookfield, Wisconsin Saturday to protest the governor's extended stay-at-home order. The so-called Liberate Wisconsin protest and others in several U.S. cities called for a restarting of the nation's economy. This week, President Trump unveiled a three-phase plan to reopen the country, leaving many of the details and decisions to governors. In his Friday coronavirus briefing, the president said he would like to resume large campaign events ahead of the November election.
I hope we're going to have rallies. I think they're going to be bigger than ever.
In New York State, where more than 235,000 people have tested positive for coronavirus, wearing a face covering in public is now mandatory when social distancing is not possible. Governor Andrew Cuomo says hospitalizations are still slowing, but warned that the state is still not in a good position.
We still have about 2,000 people yesterday who were new admissions to a hospital or new COVID diagnoses.
Boeing, which plans to restart some operations in Washington state in the days ahead, conducted its first COVID-19 transport mission. It flew a 737 jet from China with more than 500,000 medical-grade masks for healthcare workers in New Hampshire. While some states are gradually easing certain social distancing restrictions, California is keeping them in place as it deals with its highest death toll yet. Saturday night, Lady Gaga and a who's who of music legends hope to provide some relief in a global concert fundraiser, One World, Together at Home. Danya Backus, CBS News, Los Angeles.
Islands Bilingual Bicultural Association, or PIBA, donated $500 to PPE for Guam. So thank you to them and everybody that's stepped up to help our community.
And there's definitely a lot of you. 8:42. It is Monday, the 20th day of April. I just had a message from one of my friends.
What?
Worst 420 ever. Because, you know,
it is 420.
Yeah, it is 420. And the only reason why it would be a thing is because, of course, marijuana has been legalized. And it was supposed to be by this point that they had done all the rules and regulations up. But obviously that's, I don't even know backseat. It's like way back in the van, the last priority right now. But I wanted to get Will Parkinson from the Cannabis Board. Maybe we'll get him on this week and just kind of talk about it. It's 8:43. Tomas Maglotnia from the CNMI on the line now. Good morning, Tomas.
Good morning, Bree and Chris. How are you?
We're doing pretty good. There's a lot of stuff that happened over the weekend that we want to ask you about. But first, of course, we'll give you the floor and here with the latest on the COVID-19 response and developments in the Northern Marianas, Tomas Maglotnia. Good morning, Tomas.
Good morning. So, as Bree said there, one new COVID-19 confirmed case in the CNMI. This is the first case to be confirmed at the CHCC laboratory. It's of a 57-year-old female, and that female is in stable condition and is safely isolated at Kanoa Resort, according to the CNMI Governor's Office. This brings the CNMI's total confirmed cases as of yesterday to 14. This new case was confirmed at CHCC laboratory using a newly acquired testing device, ID Now by Abbott and Alere. The ID Now COVID-19 is now available for use under the U.S. Food and Drug Administration emergency use authorization. Results can come in as little as 5 minutes, according to the governor's office. The CNMI governor's office also sharing that they will continue to send specimens that fall within other testing priorities off island until the CNMI can get other testing platforms for the overall testing strategy. They add that CHCC with the governor's COVID-19 task force has beaten its proposed timeline by 2 weeks with this FDA-approved platform. Also on Saturday, 5,000 additional test kits arrived on island from South Korea. This means that the CNMI is now waiting for the remaining 35,000 more. On island, we now have 25,000 test kits from South Korea. In that same announcement, the governor also saying that construction continues on the alternate care site at Kanoa Resort Hotel on Saipan. Torres also saying that the NMI task force will be meeting to discuss detailed projections for cases on island in an effort to flatten the curve. The governor's office saying that they will also continue to send specimens off island as CHCC continues to prepare for the CNMI's community-based testing strategy at the end of this week and the early start of next week. And just to remind folks, priority 1 testing, according to the guidelines followed by the Commonwealth Healthcare Corporation on island, is for patients and healthcare facility workers with symptoms at the hospital or alternate care sites. And Bree and Chris, we're also working to speak with that Saipan doctor who, is being also using these test kits, and as they continue to schedule the community-based testing with those thousands of kits that we now have.
Mm-hmm. Hey, are you hearing anything about the, I know that the governor mentioned it briefly in his Facebook post over the weekend about this, how they're working with the CHCC, and it sounded like they were going to be issuing some sort of a trajectory for the CNMI.
Yes, that's correct. Other than what was mentioned in the Facebook video that he posted, there isn't much else we know right now. I know for the CNMI, most of the projections have come by FEMA through the by way of U.S. Congressman for the NMI, Kilili. And so, so far, that's the latest projections we saw. We spoke with Kilili last week, and he spoke about those projections.
Mm-hmm.
And yeah, we're going to continue to follow up and see if those numbers are going to be released to the public, because I know folks are concerned about that. I should also say that I went ahead and followed up with the CEO herself this morning to confirm that 9 are recovered in the CNMI and 3 are stable condition. So those are the statuses of the confirmed cases we have.
931, and there was 2 deaths there, right?
Yeah.
Okay,
so
that makes the 14. Yeah.
Yeah, because we want to, we heard that the most recent case was stable, so I wanted to follow up on the 2 that were announced prior. So she says 3 are stable. So.
Okay.
Tomas, I know you had mentioned that there is that discussion to conduct the mass testing. We're getting some comments here. How far along are those talks, and are we going to see something to that effect maybe this week, or what can you tell us more about that?
Yeah, and so we spoke to Esther Muña last week, and she said 2 weeks from now, and then this morning we were talking, and they're actually starting to schedule those tests. And so they're calling it community-based testing, as she was explaining to us earlier, and as we reported, this is done as a public health, effort, because for the test from South Korea, and we're going to follow up on the logistics. Again, we're not necessarily sure if this is a drive-through or if this is a village by village, but these are things that we're expecting to hear, as early as tomorrow, we hope, or later this week. We definitely know that they said that, and they're also still waiting for the 35,000 more, so I'm not sure what their plan is in terms of rationing out all those tests.
Were you able to hear a conversation with Frank Mansell of FEMA?
I heard a bit of it. What part of it exactly?
Well, he was talking about these South Korean test kits and how if states are ordering them and ordering large quantities, the assumption is, and also he said this about the NMI's case, that they are going to be reimbursable expenses.
Yeah, and that's what the CNMI governor's office told us. We're working on to get the cost for that. We know 60,000 is not a small number by any measure. That's the entire population practically, and so. I think that, I think also just to add more context, I think there was about 3 or 4 South Korean manufacturers who are contracted. So this one from Solgen is just one of them. I know looking at other national media reports, other cities across America are getting South Korean test kits from the, one of the 4 manufacturers that got that preliminary approval. So South Korean test kits come from those different manufacturers, as we said.
Right, and so what Frank had said was that if there was a request made by the governor of Guam, that would probably also be. So, we'll see if it develops. Right,
that's definitely, and hopefully, a lot of folks want to know when, are asking the question, when can I get tested? So, I think that question will be answered later.
Yeah, I think that is interesting to see how logistically this is all going to play out when you do mass testing. So
yeah, I heard someone on your show last week. I'm not sure if you remember, but someone said it would take about 100 people a day to do this. I'm not sure which doctor said that.
I think Dr. Cabrero was talking about it. It depends on like the machines, I guess, how many you can run, right?
Yeah.
And so how long will it take? Because you have 20,000, you can only run 100 a day. That's going to take you X amount of days and months to actually go through all those tests.
Right, and again, just reiterating the hospital CEO, there's, they're working also, part of the effort is to also validate those South Korean test kits with the approved equipment. So I know the controversy continues in terms of, where and who and why.
Looks like we buy American here on Guam.
Oh, boy. Yeah.
Sorry.
Thank you, Tomas.
Yeah. Is there anything else you want to share what you're working on for today, Tomas?
Yeah, I'm just going to do that wrap up. We've got so many. I know also in the CNMI, there's the Commonwealth Bureau of Military Affairs announcing that the medical team, the deployment support is led by Brigadier General Tracy Smith on island to help. And so we know that there are lots of experts here now kind of monitoring all the developments. I think I should also note I think today marked 21 days since the last press briefing we've had by the governor and the task force, and so
you guys should send him a miss you card.
But we know that we continue to see those Facebook video updates and the graphics. But of course, as we've been saying, it would be nice to have all the media there to ask questions.
Of course, Tomas, but I mean, we're all dealing with it. I mean, we had some conversations last week of the same thing going on in Guam. I know we have our one press conference a day, but again, there are just way too many questions and not enough answers. So.
Yeah, and it's this week especially is a busy week. Hearing from some of the professionals doing this work, scheduling those community-based testings, or some people are calling it mass testings. That's elaborate and difficult. So I know a lot of the time is being spent on that right now.
We're getting the comments here. Glory writes in, can you imagine if the CNMI starts mass testing before Guam? And then someone else, Chester, writes, I think they will be way ahead. And then Jovange chimes in, it would be really so sad and embarrassing.
Yeah, and I think I was thinking about this because, people are saying, you might be fixated on these tests. But if you look at, all the leading professionals, even at the national level, the number one thing they say we need to be doing is testing. So,
testing, yeah. So. And you're right. And I think that if we're going to start talking about recovery, that's fine. But, if we're going to take actual steps towards recovery, then I think we need to do if you look at any jurisdiction that's dealing with COVID, South Korea included, how did they kind of get around that curve is by conducting the mass testing.
Right. Yep. Yeah, and
test.
Hopefully we get that soon and get some video out of the CNMI.
I like it though. I like that you guys are to me, I think you guys are a little bit ahead of Guam in your response. I mean, it looks like you guys are actually looking for people to test, whereas on Guam we're testing as few people as possible based on the criteria, but I love it.
There's commercial testing at DLS.
There's commercial testing. No, I'm just saying, but when you bring it up, it's always a little weird. There's a couple media who they ask the governor these questions about, hey, CNMI is doing this, CNMI is doing that, and she gets like triggered about it, So obviously there's some kind of like rivalry. I'm pretty sure it's partisan maybe between the CNMI governor and the Guam governor, which is really unfortunate because I think we should be pooling our resources and our ideas together instead of like, no, you guys do your thing and we're not going to even know.
Yeah, and I don't think that's I don't think that's unique to us. You see a lot of reporters in different states saying Nevada did this, California did that, and I think the intention, my interpretation of that is that when citizens see other that what's possible, then they want to know that it's possible here too,
Exactly. I mean, we have a little thing called the internet, and you can go and look at things and see what other places, and it's really, we don't have to sit here and defend why we're asking the question. It's as simple as compare and contrast, which is just, one of the most basic media principles. And people are doing it. It's not even the media. You see the comments, everyone's like, why are they doing this? We're not doing that. So
you know what I always I've been thinking about this, what I think would have been really, really neat, because this is unprecedented times. If we just saw some of the former governors all came together and provide dialogue, see discussions with them, and in how do we get through this crisis. You have former Governor Carl Gutierrez. I think that question was asked by Adriana. You have former Governor Calvo, former Governor Felix Camacho. All of them have been through, several disasters, and it would be and recovery. So I don't know. What do you think?
Seems like we got a lot of good minds that we should be using more of.
Yeah. Anyway, that was just something
definitely.
I thought about.
Yeah, Bree, that's interesting.
I told you guys.
I think provide some stability in a way.
And I'll tell you again, we reached out to former Governor Carl Gutierrez, and the response he gave me was he wanted to respect that the governor was handling this public health emergency. And I really tried. I was like, man, Uncle Carl, you people want to hear from you. You got all this experience. You know what I mean?
PACA, Pongson Washa, and Asian Economic Crisis, KAL, It's a lot of experience.
It is, and I really, when we asked the governor about it Friday, Adriana asked about it. You got like a 20-second answer, like, "Yeah, he's around here somewhere," and they email him or whatever she said.
And I think we've covered every single one of those too.
We have, and when she named her Economic Recovery Council, she didn't name Uncle Carl on there.
Yeah, and I think for the NMIs, and we're waiting to see if something like that happens here as well.
Wow.
I think there might be some things in the works.
Well, did they indicate when that trajectory was going to be out?
No, they didn't. But based on, I don't know if they're going to be basing it on the same reports that the Congressman Kennedy has been putting out. But yeah, I'm looking forward to seeing that published.
Okay.
All right, Tomas, thank you.
Be safe out there.
Thank you for working around all the barriers that you got out there. And, I mean, you're doing a great bang-up job. We're getting a lot of comments about the information you're putting out. So, I just wanted to start this week by patting you on the back, boy.
Oh, all right. Well, I don't want to see how the end of the week is going to be. Thanks, Chris.
Okay, Tomas.
Okay, bye.
Wash your hands.
Bye. Thank you.
Okay, Tomas Maglotnia. Man, love having him on the team. Let's keep with the phones. There was a letter that Senator Sabina Paris had put out.
Right.
And you got that up there?
Yeah.
Somewhere around here.
I read it. I didn't read the whole letter.
Okay, we got her on the line. So if you want to just go over that, then I'll pop her up. 8:56. Also, we're going to get Ken Lujan from the SBA to let us know what's the way forward now. Are we just treading water with the funding for this Paycheck Protection program drying up? Go ahead, Bree.
Okay, so Senator Sabina Paris, she wrote a letter over the weekend wanting more information from the acting banking and insurance commissioner, which is the director of the Department of Revenue and Taxation. She wanted more information about the PPP program. 508 Guam businesses and nonprofit organizations were able to secure more than $102 million as part of this PPP program. But she had also received information that some local businesses had applied for this PPP, but and they turned in all the necessary documents and information, but apparently they were never submitted to the SBA. And so now we're in a situation where the PPP has ran out of funding.
Right. And so let's just get the senator on here. Good morning, Senator.
Good morning, Chris and Bree, Sabrina.
Good morning.
Good morning.
So yeah, I just wanted, have you heard from Daphne yet? And two, can you tell us more about these businesses that applied for these loans that were never submitted to SBA? That these businesses have reached out to you personally and told you?
So I've been keeping tabs on this from the very beginning, as far as when the Payment Protection Plan was first announced, and I don't have too many details, but I just have heard that some of these businesses were very diligent about submitting their applications even before the April 2nd. They submitted the application before the guidance change. And I think in looking at some of the information that perhaps the S corporations and C corporations had more of an advantage because the guidance in applying for this was fairly simple, and when it came to sole proprietorships, their guidance changed midstream, and so they had to resubmit some of the information, and so because there's a huge influx of applications, it's somewhat kind of. And looking back at this, I'm wondering if that was one of the factors in creating the situation. I've had complaints coming from these small businesses saying that they submitted their applications early on in the process and only to find out later that the funds have dried up. So that's a cause of concern. But I just wanted to find out what were the factors involved in this, and considering that this is a new program and the guidance changed.
Everyone to do go apply. So I mean the damn website was crashing. That's how many people were trying to apply for these.
That's right.
These loans, and it's unfortunate that I can't even imagine being a business, a small business, or a sole proprietor or whatever type of business that applies for this loan. I mean, it's pretty much life and death for a lot of these small businesses, and then to get the call that, well, you jumped through all the hoops, you got all your paperwork, but man, your application, it fell under the table, or what were these businesses told, Senator? The dog ate their application, or what?
Just basically the funds dried up, and they weren't able to process quickly enough. That's just one of the things that I'm finding.
Right, but so if they
weren't able to submit,
if they applied and then they turned in their application to the banking place, and then
the banking place didn't turn over the application to the SBA.
Right, and then
that's what you're being told.
Yeah.
So that's some of the information that I'm getting. That it didn't appear to be a first come first basis. It was, and I believe some of that had to do with the type of corporation that it was, whether it was a sole proprietorship, a corporation type. But it is concerning to me because I've even had employees reach out to me and are very concerned about their future. They were relying on this payment protection plan to keep them going through the pandemic. And so I think any information that we can get to help improve the situation. I understand there's potentially another round of funding. So, whatever that we can do at this time to speed up the process, I think that would be crucial.
So no response yet from Daphne?
Yeah, we sent out the letter yesterday, so I didn't expect a response.
Okay. Yeah.
Quite yet, yeah.
Right, but we kind of heard about the PPP running dry since Thursday. So.
Right. I think we were actually the ones that told the governor about it. Because it was in national media, you know what I mean? And then it made its way over here, so. Yeah.
Right, and it wasn't clear. I mean, I believe in her statement, she said that there might still be money, but I guess it wasn't clear then at that point for me. But so we want to find out more information since the Treasury, they already published a report of the breakdown of, what was received from each of the territories and states, and a breakdown of how large the loans were. Mm-hmm. So we wanted to see how that applies to Guam as well.
Mm-hmm. Have you heard anything? You have oversight over Reventex, is it correct?
Yes, that's correct.
Have you heard anything in terms of what's new with the stimulus checks, or how soon? Are you getting any briefings from Daphne on that? Because I know we're still waiting for the IRS approval.
Yeah, no, I haven't heard anything yet. So I'm trying to set up a debrief. I reached out to the speaker to set up a debriefing for the senators regarding what's happening. So I've yet to hear back regarding that, the setting up of that meeting.
Senator, would you support something like a committee of the whole type setting where you guys get down there in all your gloves and your masks, and then you either through Zoom conference or whatever, get some of these people leading the COVID response, or but Daphne or any of these cast of characters who are leading the recovery front and just all the different fronts? Is that something that you guys, because I know that's a couple of senators have been asking for this, is that something that you guys would like to see?
Absolutely. I definitely would like to see more transparency in all this information. I think that would be great. I mean, if we can have our next session, I don't know when our next session is going to be, but that's something I would support and promote and advocate for.
I think it was Senator Teresa Law who had wrote to the speaker. You guys had a Zoom or something last week and had wrote and said, hey, can we put this up in committee of the whole? And
yes, that was right before the voting, and we did get a briefing from the advisory committee.
Okay.
But yeah.
What was in the briefing? Because we haven't heard. That was that Thursday or Friday?
So that was right before we voted. So that was on Thursday, I believe.
Right. So what was the nature of that briefing? Did they tell you anything about a new trajectory or anything about the past models? What can you tell us?
No, they're still planning for the 20% reduction. So 3,000 potential deaths, and so they're planning for the peak,
right.
The expected peak, and so that means they're looking at I believe you said on your show earlier, they're looking at expanding facilities in the parking lot of GMH and other areas around Guam. I don't have all the information in front of me, but they're planning for that scenario.
Did they talk about recovery and this
opening up Guam?
Yeah, I don't even. Now that I recall, is anybody from the legislature on this recovery panel?
I didn't hear any senators' names.
Yeah.
I didn't. Haven't been briefed on that one. And so one of the things that came out of that call is that we were supposed to schedule regular briefings with the advisory panel. But as far as recovery, I think it's interesting that, you know, in your show earlier today, you're talking about mass testing and, you know, the South Korean test being utilized by Saipan and how that's not yet, recognized by CDC. But I recall in some of the early conversations, I think before the quarantine, self and home isolation, that there were some doctors that were actually advocating for the use of testing kits. From some of the anecdotal evidence, some of the healthcare providers are saying that the South Korean testing kits are, more reliable than Chinese ones. And so, in thinking about how they're not yet approved, perhaps we can utilize those kits for those that are deemed recovered. Because, I understand as a former medical technologist that, you have to do some validation of any kind of test kits. And so perhaps I understand what the CDC is thinking, that if a test kit is not validated, then you would have to probably do double the work for a kit that's less reliable. And then I think that's perhaps one of the thinking that they have. This is a policy decision that they're going to abide and be compliant with the CDC, and that perhaps going with a different non-validated test kit can provide double the work.
Right.
And so I understand that aspect. But in regards to the South Korean kits, I think perhaps that could be utilized for, recovery cases. We want to keep monitoring those that have been tested, and checked out to be okay. I think you bring up a good point. Is that what happens if there's a reinfection or reactivation of the COVID?
It looks kind of like unresolved, like the recovery science. When I was, God, I just Googled stuff, but the information's all out there, national media reports, and looking at it, it really seems. I know the CDC has their guidelines, and I'm not a doctor, but they kind of seem like a little on the easier side. So the impression I get, and I hope I'm wrong, is that we're just churning out these recoveries, and I don't know if there's enough follow-up with testing these people, because God knows we're limited on test kits. We're only testing you if your eyeball's falling out on a Tuesday during an eclipse.
I think with this is a totally new situation. Everybody we're learning as we go along. I think that's the part of the problem, and we're learning from the other countries like Singapore and South Korea. What are they doing? And then now we're seeing they're having spikes that are happening in their countries. So we can't just relax yet. Even though we feel like we have it under control, I think especially because our community is a lot of our people in our community are at risk. I mean, we have higher rates of diabetes, heart problems. I think every precaution that we can take is I think advisable. And so.
Can we just ask you about tax refunds real quick? So I'd asked the governor a couple weeks ago about paying out tax refunds sooner than the 6-month timeline, and I kind of got my head bit off. So is that anything that we're thinking about, or are we just trying to shoot out these stimulus checks real quick? So because people are asking, people want to know. They filed. We're up to November, I think, and then the court order says that we have to pay them out within 6 months of filing. But when I asked the governor the question, she said, "Oh, we're current," but she meant we're current in complying with that court order. So people are wondering, they owed this money. Is there any chance they could get it inside of 6 months instead of having to wait? What is a conversation? I know that a few of your colleagues have made that ask.
Yeah, and I'm not sure what the response by the governor, and I guess I can only speculate. But yeah, that is definitely something that I feel should be also prioritized in addition to getting the stimulus checks out. I think I understand that perhaps it's a capacity issue. We're not online. We don't have and so everything's done by hand, manual paper checks and everything. So I think that's something that needs to be addressed, and it's something that I brought up with my office and with DRT, consistently. So I think hopefully we're going to move in that direction yeah, I feel it's a capacity issue at this point.
Okay. Well, thank you for your time. We're going to get Ken Lujan from SBA just to kind of, I mean, the well is dry. Want to get him on and find out what they're telling people. Are we still applying and all that stuff? So thank you so much, Senator.
Yeah, appreciate it. Have a great day, guys.
Yeah, you got my number. Keep us in the loop.
All right,
Text
thank
me
you.
right after that next briefing, so I got a little, Don't worry, you won't be the only one. I cover our bases. Thank you, Senator.
Thank you.
Be
Okay,
safe.
bye.
Take care.
What, you got to work the sources, Bree?
Hey, you're telling me? Okay.
Yeah, I know, right? You're telling me. 9/11. Hey, we're going to take a quick break. Ken Lujan from the SBA is coming up here. It's containing COVID, the KUAM News Takeover, Guam's favorite. Good morning.
Had a Big Mac. Who saw me?
Be healthy. Be informed with ITD.
Top of day, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important.
Hot for the day, everybody. I'm Sabrina Salsmantinati.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen.
It's the KUAM News takeover of I-94, 917. We are just all over multimedia on you. Facebook live stream. Good morning. We're going to get some of your comments out here. Keep commenting, asking questions. I got it up here, so I see what you put. Getting a lot of comments about testing, mass testing. I think we talked about that with pretty much all of our callers and where we're at on that. 917. I wanted to get former Speaker Judy Wampat on. She's, of course, heading Varo Victims Advocates reaching out. And Madam Speaker, we didn't get to touch base with you on this chain of events with the Attorney General releasing a couple of suspects that kind of caused this big chain reaction where the governor, basically scolded him. And we just had the Lieutenant Governor also on, and they all had a problem with this. But I wanted to go back to the victims, victims of crime, and just because we haven't touched base with you since this COVID started, just on the Varo end, what are you guys hearing from victims out there?
Well, I actually had the hotline over the weekend because, I'm one of the volunteers, and I had actually 3 calls that weekend, and I was kind of concerned because normally the first thing I would do would be to refer them to DART, which is a separate unit specifically for domestic violence and sexual assault. And I gave the emergency number only to be told that there was no answer. And so we had to, call other people that we personally knew, that used to work for DART, and were able to make the connection. The other thing that disturbed us was the victims told us is that they had cases filed, and to date they had not heard anything, whether there was an investigation or an arrest, and that was very disturbing to them because they were fearing for, again, that the abuser would could very well come back. I mean, seriously, I was very worried for them as well because nothing was being done. And so I mean, I'm only talking about 3 that I know of currently that I had taken the hotline, but I've actually heard from the staff that they were hearing the same thing, that the abusers felt that they were not being, that the reporting of the abusers were not being addressed. That means they were not arresting, they were not questioning. And so, the only thing I could think of was the fact that, that announcement was made is that there were, I guess, just getting the information and then releasing them. So that was very disturbing.
Yeah, well, one is too many. I mean, I can't believe that the domestic assault response team, no one's answering the phone. You said you had reached out to people. What response did you get in terms of?
Other than the fact that they said, okay, they themselves will call. So. And the phone calls I was getting was afterwards, after normal closing time, but there is a specific emergency hotline also separate from the 8 to 5 phone numbers, and neither one, of course, of those numbers were being answered. So we normally don't do this, but because we just give the number to them to assist them, you tell them where they need to go, who to call. But that particular time that we were actually making the calls ourselves to DART because we were worried about, the victims. And fortunately, because, we had a former employee of Varo, he was our connection, and, went ahead and gave case numbers and reports, but that's as far as we could go.
Wow, so you had to call in your connect.
Yes, unfortunately.
Madam Speaker, we were looking at this whole deal with the AG letting these knuckleheads out, and clearly it was violent, a crime in my opinion. But we had also, in looking at some of the people who were being booked to release at DOC, there was one case. I don't know if you have that in front of you.
I don't have it in front of me, but I do recall that
Okay.
one of them was a family violence case.
And I want to say it was a third-degree felony. She's going to pop it up here, Speaker, because we definitely want to get the information right. But what I want to do is I want to call out the Attorney General again, because he had said that they were working with a crime spectrum table where, nonviolent offenders like your ICE dealers and, people who do property crimes, that they would be booked and released, whereas violent offenders would be booked and confined. But that's not even true. So I don't know if the AG is not reading the police reports, or, maybe their office is only open for an hour, so they don't have time to really do what, we elected them to do. But the information here that we saw that came, what is it, Bree?
Okay, so this was for an April 14th. I believe it was an arrest, and it was for family violence and aggravated assault, a third-degree felony. And the person was issued a notice to appear for April 7th, 2021. So
Right.
for about a year.
So I guess just first of all, according to the AG's criteria, Madam Speaker, would you classify that as a violent crime?
Oh, absolutely. I mean, you can't see that any other way. For those, of course, who've never been through it, they may think not, but for the victims themselves, it really is, I don't know how to describe it, but I was literally very worried because the individual was, very fearful, not knowing, of course, that the individual could come back anytime. She couldn't sleep. She was crying all the time. She didn't know what to do. She was even going to get into her car and drive around somewhere where maybe you wouldn't find her, but then, of course, the car could be recognized. I mean, the women were literally afraid for, their lives. And I just couldn't understand, honestly, why, this would not be considered a very, it is a violent crime when you violate, a person, physically violate a person. I can't see it any other way than that. Because not just affects them physically, but emotionally, and you're scarred forever.
You're preaching to the choir. I just wish the AG was in the church with us, because he's not hearing the message.
Well, I don't know what else could be done. I mean, trust me, I've been even researching this myself to think, what could be done. How do we provide, even law and order after working hours? How do we help these individuals who are self-quarantined, and if the abuser is within the same household? And the only thing we can really do is to give them a safety plan, just in case when there's an opportunity. But even with that, then, a lot of these other organizations that we normally work with can't even take them in because of, COVID-19. And so how do we provide even, immediate safety for them? Because of this, so it really, this COVID has just compounded the problem.
Yeah, but I think, Speaker, also, there's COVID, but, come on, Mr. AG, that doesn't mean you just get to go on a vacation. and let everyone out. Hey, nobody's going to get arrested. Go do this. You're fine. Oh, you beat up your wife. We're going to put you back out there. We'll see you in a couple years in court.
I will say this, though. It's not just the AG. I mean, I'm looking at the list here, and this is releases from the Department of Corrections from March 14th to April 15th. And 69 were through court order. 61 were orders of conditional release. And then you have the AG's office with 30 notice to appear that were issued between this time frame. So it's not just...
Yeah, everybody's doing it.
Yeah.
Yeah, I mean, I mean,
at the end of the day, it's the victims, really, that are suffering and are hurting, and it could be re-victimized. So,
I mean, look at this case we're talking about. What were the charges again? Assault?
Family violence and aggravated assault is a third-degree felony.
Right. So here you have, obviously, and I want to match this up with the Maggies, but you have a case where this person was, doing what they're doing, charged with that, and obviously there are victims in this case. Now they're released back out into the public. Where does these people go? Do they go back home to the victims? I mean...
Yeah, absolutely.
And that's why I wanted to bring you on as speaker, just to kind of bring this out into the open. And we spoke with the AG last week, and we got his side, and we also spoke with the victim. But in looking at these releases that are going on, it only kind of made us think that, wow, there's more victims out there. And so a lot of them are coming to you guys at Vero.
Yes, because we are a 24/7 hotline.
Mm-hmm.
Let's get your number.
Are you going to be following up with the police department on what's up with their DART line, their hotline? I mean, we can do that too. I was just wondering if you were planning on asking them.
Well, we did. I know the weekend I had it. We did, and I know the staff has done the same thing because they really work very closely with them. So, I mean, I've not spoken to them since last week, but. I'll follow up to make sure again now that the numbers, the one number is working or that's being answered.
Okay.
Right.
Yeah, because we've worked with the DART group, and they're a really great group of people. So I'm kind of surprised that they're MIA. I don't know.
Yeah, I mean, I can understand, that we're having a skeleton crew everywhere, but, this is definitely, an emergency number, for people to call. So that should be monitored, very, very simply, just like the way we do it, with Vero, is that then the Vero number comes to my, personal cell phone.
Right.
Right. So then I can take it wherever I'm at.
Wow.
And I would think that would be the case whoever then has the hotline.
Mm-hmm.
You were speaking what's called the common sense. I mean, I don't mean to make light of it, but you are. I mean, what's next? What's next? We're not going to answer 911? Is that what's next? Forget it. Just everybody should be staying home.
Yes, I know. I mean, I realize that because there are people who think, though, that if a number was transferred to their cell phone, that, people would get their numbers, but they really don't. It's just strictly the number that gets transferred, and I try to tell that to a lot of people.
Mm-hmm.
That's
true. All right, Speaker, thank you so much.
I'm going to be WhatsApping you more this week.
We're talking about it, though, so hopefully then we can get some results.
Amen.
Right.
Amen. Okay. Thank you, Speaker.
Okay, be safe.
Okay.
You too, Kat.
Now wash your hands.
I always do.
Okay, good. Yeah, she definitely seems like a thorough hand washer. 9:30. That's former Speaker Judy Wampat. Now she's heading up Vero, and I touched base with her last week, and obviously they were pissed. They're pissed about this the story we had with the AG.
I will say, though, I know that Adriana had asked the governor her reaction, and she was upset about it, right? And so then the Attorney General, he came out with his own statement in response to the governor's statement. And just so everybody knows, he said that it was admittedly surprising that she was not happy, given that our approach was taken in line with the directives of her office and the Public Health Authority. However, now that they are prepared for returning to standard confinement practices and are working with the court to manage the prison, our office will move forward in support of this new direction.
I think I think what the governor was trying to say there was like, yeah, I might have told you that we want to keep people out of DOC, but, you know, don't be releasing the violent criminals.
Mm-hmm.
That's kind of what it seemed like to me. And then, you know, the lieutenant governor this morning on the show, if you guys didn't hear it, he also piled on to the AG, and kind of what the LT had said was like, it's a no-brainer. What are you doing?
Right, but the AG said, well, it's based on the police reports that were filed. And that's how these individual prosecutors go about making their decisions on who gets the NTA.
Yeah, but too bad we didn't get to ask him about this family violence case.
Yeah.
Yeah.
So I'm not done with this story, so.
Thank God. Yeah, and it's just, I mean, there's just so many things going on with this COVID, from the testing to the, you know, assistance that we all need, to, you know, we're on lockdown until May 5th, and, you know, people are getting restless. People are going to go out there and they're going to commit crimes, especially when you have the man that we elected.
And I see a lot. I see a lot of the videos that are posted on social media of people breaking into this house and people breaking into that house, stealing cars.
Yeah. And just for the AG to call up and actually say that, yeah, if you're doing property damage, if you're doing any of these, you know, so-called nonviolent crimes, then guess what? You're not going to really have to deal with it until we take you to court in a few years.
Mm-hmm. I just think all crime is bad.
Definitely, yeah. I mean, of course.
Violent.
Right.
It's all violent.
I mean, yeah, it's all. I mean, someone smashes your windshield. That's not violent. No. 9:32. Let's switch gears. Go back to a road we were driving on a little bit ago with the Small Business Administration, and bring Ken Luhana, the SBA. Good morning, Ken.
Hi, Ken.
Chris.
Just, I guess, real quick, I got the numbers, and we all know that the well is dried up, but just locally, what are you advising small businesses in terms of whether or not they should still apply for these Paycheck Protection Program loans?
Well, you know, we're somewhat anticipating that the $250 billion would be addressed within Congress in the near day or two. My understanding is Congress convenes tomorrow, April 20th, and so at that point in time, they're going to have some discussion relative to the $250 billion package. There are some debates right now going on as to the use of those funding, but for the most part, the majority of it will probably be going to the PPP program for disaster relief again. The advice I like to give out to the community is continue on, meet up with your banker, discuss your issues with the banker. Some banks have informed me that they are still taking applications. However, these are going to be completed applications, so make sure that you complete your application before submitting it over to the lender. Incomplete applications are probably not going to get through the system. The other thing also is that should that run out, you know, we're looking at the possibility of having our additional funding in our EIDL program, which does not expire until the end of the year. So that's another option that they can look into sometime in the future. So immediately, I think the concerns that people are looking at is the PPP program and trying to get advantage of it. I kind of did some numbers, and I was looking at this and projecting probably within a week or two that money would run out again. So my advice to them is get your documentation in order, put a complete package together, and work with your local lenders here in Guam.
You know, there was 508 businesses that were able to secure a part of that $102 million before the funding ran out. Are you aware of how many other applications are pending?
From my understanding, there's a lot more applications in each lending institution. Some of them have said they've got hundreds of applications. Some of them have said that they're still trickling in. And I still continue to have had calls even after the closure of the program. I've had calls from other companies, other businesses out there that are just now hearing about the program.
Wow.
And so it kind of goes beyond that. So the ones who are pretty savvy and business owners who really need the money, they were the first ones in line. Others are probably not attuned to what's going on within the media or within their business surroundings, and those are the folks that are kind of left behind in the whole process, unfortunately.
Mm-hmm. What about, there was a letter by Senator Sabina Flores, and she was mentioning that there were businesses that applied for the PPP. They turned in all the documents. They got everything that was required of them, but then they were told that they were just never submitted to the SBA. Have you been getting complaints regarding this?
Yeah, again, depends on what you're one of the 100, then yet you're incomplete. You may have to go at the end of the line because again, they're not going to spend a lot of time working on your application if it's incomplete.
And
They don't have time to contact you and say, "Hey, Chris, you're missing your financial information."
No, but her letter was that they were told that their application was in good order, that it was good to go, but it just wasn't turned in to SBA.
That it wasn't turned into.
Yeah, and were later informed that their applications were never submitted to the SBA.
I can send you a copy of the letter too, Ken, if you want.
Okay. Well, then I would suggest that the company or the business applicant have to address that personally with their lending institution because
That sounds like their problem.
That's who they bank with, and that's where the services come from.
Well, it kind of sounds like, Ken, that you're saying that people are having a problem in completing this application. Is it pretty extensive, or what are to your knowledge, what parts are people not completing and having a problem with?
Well, the biggest concern that everyone should have in the PPP program. I mean, the application's pretty much simple. It's similar to what the bank's requirements are. So it's not as if they've never been down that road before. The key there is when they talk about forgiveness. This is the PPP program, forgiveness. The assumption out there in the community that we're going to put my application in and I'll be forgiven. Well, it goes beyond that because of the fact that you have to show evidence to the lending institution and to SBA that you actually did utilize that money. Those funds were actually going towards the payroll. You either rehired people or you brought them up to brought your workforce levels up to the same that it was prior to February 15th. Now, again, using an example, if I had 10 employees prior to February 15th and I had to downsize, just keep 5, and then I apply for showing my payroll up to 10. When I get those funds, I should be able to bring back those 5 individuals or rehire 5 new individuals. Now, if you don't demonstrate that to the bank and to the SBA, then it's not 100% forgiveness. It's now 50% forgiveness. And the other 50% becomes a loan. And so they have to look at that and take that in consideration because, again, those are, they have to submit the documentation to prove that they actually use the funds for that purpose. Again, the objective of the program is to get people back on the jobs, get them back to paying, get a salary for at least 250% of the time, and actually have them utilize those funds to regenerate the economy, stimulate the economy. That's the objective of the program. Mm-hmm. But if they can't prove to it because they're lacking documentation, then of course, banks have to look at that and consider that too as well.
Do you field a lot of questions on your office line there, Ken, from people who ask about the process?
Every day.
Mm-hmm.
Yeah.
Even in weekends.
Wow. And are they? Is there desperation there, Ken? Because I mean, we're in this. It's been 5 weeks or over a month in. These non-essential business closures. People are hurting.
Yes, I can see it. I can actually hear their expressions, their voices on the phone when they discuss it with me, and I understand where they're coming from because the business is the lifeline of any economy, and if we don't take care of that lifeline, then everything else fails. So that's the reason why the stimulus is in there to help the lifeline. Because I always tell people, I said, what's the color of our blood? It's red. But what's the color of the blood of the business? It's green. It's cash. If they don't have that, they're generating the economy. Then nothing. Then we're not going to survive.
And what was the response? I'm sure you rub elbows with a lot of business people when the money dried up.
Well, it was kind of disheartening at first because of the fact that a lot of people weren't able to get the afford the opportunity to submit their application in. But keep in mind that we initiated from the get-go once this CARES Act was passed in March 27th and the program for the PPP opened in April 3rd. It was indicated there that this was on a first-come, first-served basis. Mm-hmm. And the fact that it was first-come, first-served, the assumption out there in the community is that they set aside $1 billion for Guam or they set aside a couple $1 million for Guam. That was not the case because all 50 states plus the U.S. territories, Guam, CNMI, American Samoa, Puerto Rico, Virgin Islands, were all thrown into this clump of money and said, okay, whoever comes in there for that front door, the first one to be entertained.
Yeah, but wasn't the website down?
That was for their EDIL program.
Okay. Is the EIDL is the money ran dry for that as well?
Correct.
Okay, so it's for both programs. Okay, I just want to clarify. And what is the new amount that Congress is looking at?
They're proposing $250 billion.
200, and that's also going to be first come, first serve.
Yes.
And then so how it works, Ken, correct me if I'm wrong, is it's a big pot, and then the states get theirs, and then the territories get their part?
No,
is that
it's just one
pot.
Coming out of Treasury, yes.
So
you
fill out your
guys better be ready to press.
Application should be done. Call your party at the bank.
I've had some conversations this morning, prior to you calling over, and the message I've been, relaying to them is that, complete your application, talk to the lender that you can, and if these lenders are telling you they can't help you, go to another one. We have 7 on Guam.
Mm-hmm.
You can select from. I mean, you get the 5 FDIC banks and 2 credit unions. You got Coast 360, Community First, Bank of Guam, Bank of Hawaii, First Alliance Bank, ANZ Bank, and Bank Pacific that can actually help you. If one bank doesn't help you, then go to the next and go to the next until you find someone who opens the door to you.
Right.
But just go.
Ken, so we had, what was it, 508 businesses that got these loans?
Business and nonprofit organizations.
Right. So how many more do you anticipate will need these loans if we have hundreds of apps on waiting?
Well, we have 3,000 plus businesses here in Guam.
Oh, my gosh. That's a lot.
And they're all affected because of the virus situation.
Mm-hmm.
500 is just a drop in the bucket.
Wow.
But imagine back in the mainland, if we're looking at a particular state, in California, one day California submitted 700,000 applications, which is the reason why our system went down at one time.
Right, right.
And so it's just not Guam that's going to get a fair share.
Yeah.
You have to go there and compete with everybody throughout the world, throughout the nation there.
Well, great.
So apply now.
Yeah.
Apply yesterday.
Well, prepare your application.
Right.
Talk with the lender.
Yeah.
Because again, some lenders are willing to take it in, some people are not. So talk to the ones who are willing to take in the applications. We're still doing some research on who can and who can't. But these are your lenders. These are the folks that you talk to on a regular basis. If you're doing business transactions,
mm-hmm.
you go into the bank, you do deposit relationships, checking accounts, savings accounts, you open up lines of credits, you get loans. These are the bankers that and they know you personally. So work with them. Try to get to them and appeal to them and say, listen, I need assistance.
Bring them empanada.
Yeah. Bring mango.
Yeah, where's the mango? It's season starting.
There you go.
Okay. Ken, the website, where do people go if they got FAQs about this?
They can actually go to SB's website at sb.gov/coronavirus. That would identify the 2 programs, the IDL as well as PPP. Or they can go into the U.S. Treasury's homepage. Just Google U.S. Treasury. And there's a 4-page PPP application there as well as fact sheet information. So those are the 2 sites I would recommend that you go to.
Well, Ken, thank you, man. It sounds like it's kind of weighing pretty heavy on you, knowing that, these businesses have kind of fell through the cracks, and we're just really waiting for Congress to sort everything out. So
yeah. The one thing I'd like to share also is that, I'm not doing this all by myself because I got some assistance, with our Small Business Development Center at the University of Guam. They've been very helpful. It's one of our programs that we help clients who are in need of putting applications together or helping them put their documentation together. And it's done for free, so all they need to do is contact the Small Business Development Center at the University of Guam, 735-2590. Set up an appointment with them. They can help you with it. Again, don't wait. Don't wait until the last minute. If you do, then what's that saying, Chris? The early bird gets the worm?
Yep.
Mm-hmm.
So if you don't wake up in the morning because you're quarantined, you figure out, okay, I can wake up at 11 o'clock, you can snooze, you lose.
Mm-hmm. Again, that's 735-2590?
2590, yes. Yep. Small Business Development Center.
God, I don't think I ever woke up at 10 o'clock in my life.
Yeah.
Okay. Ken,
All right.
thank you, man, so much, and keep doing what you're doing. And I feel your frustration, and we're so glad you took the call and got the info out there.
Well, I'm here to help solve this. So please, by all means, just pass the word out that they need to do their part too in terms of getting the information that the lenders need.
Got it. Thank you, Ken.
All right, take care, guys.
Wash your hands.
We'll do.
Be safe.
Okay.
Take care, everybody.
There you go, Ken Lujan of the SBA. Something I don't think we saw coming. I mean, wow, federal funding for that loan program drying up. Who saw that coming?
Apparently, what was it? 300 is just not enough. It's on a first come, first served basis, and everybody's competing for the same pot of money.
Yep. So like Ken said, man, call your banker, get them some donuts, maybe order them lunch or something, and get that application ready. Fill it out. If you already had an app in, maybe call and check the status of that application. 948. It is containing COVID, the KUAM News takeover of Guam's favorite, I-94. There were a couple little videos that we found. Bree was doing some surfing this weekend.
No, it was sent to me.
Oh, it was sent to you. Okay, so I wanted to start with this. Can I play this one with the sailor? Oh, okay, never mind.
It's on his YouTube.
Yeah, it is. So this is a guy who is actually in quarantine on Guam.
Mm-hmm.
And we're going to play this, and then we're going to end the show with a really cute video. This is so cute. You're going to love it.
Mm-hmm.
But just kind of a little insight, because obviously we don't have eyes in the quarantine facilities where these Roosevelt sailors are. And so it is what it is. This guy's talking about getting his breakfast. So we're going to go ahead and play this for you guys.
Hey, so, oh, sorry, my bad. This is my breakfast. I got hash browns, excuse me, crunchy, pretty good, I'm not gonna lie. These are the first real eggs that I've probably had in months, and I can tell they're real. Just by the way they look. So this is my breakfast. I got 3 pieces of sausage, like 6 pieces of bacon, a bunch of little hash browns. I gotta try another one of these. They're amazing. Probably 2.5 eggs, 3 eggs maybe. And these croissants, they look like they're made, I don't know who made them, but maybe here, I'm not sure. They're filled with jelly. This one, I don't know if it's filled with anything. It kind of feels like it's weighted. And then I had another one that was absolutely amazing. It was filled with grape jelly. So, excuse me. That's my breakfast. I think it was sitting out there for probably an hour or 2. I set my alarm clock for 8 in the morning because I was afraid that I was going to miss breakfast and I wasn't going to get it while it was hot. And I never heard a knock on my door. So medical came by around 9 o'clock and knocked on my door. Bang, bang, bang. Hey, it's medical. Hello, answer the door. And got up out of bed. I was already awake. Went over to the door and they did my temperature check and asked me the series of questions. Do you have a fever? Do your bones ache? Do you have shortness of breath? Are you coughing? Are you sneezing? All I answered no, although I do kind of feel funny. I don't really know what it is, but we'll have to see by tomorrow. I'm going to do a workout today. I'm probably going to do 100 push-ups, 10 minutes worth of planks, 100 sit-ups, side planks left and right, and I think I can manage some dips and stuff like that in here. And then I'm going to do a stretching session that should be pretty good.
On it, and then I went back and looked at his history of his posts, and that was, I think, from 2 weeks ago, and then his most recent one was about a week ago, and he hasn't posted since then. I can check again today.
I hope he's okay.
Yeah, I hope so too. I mean, most of his posts are about, what he ate, because that's really just what they...
What else are they going to do?
Yeah, and they get to look outside, but it's mainly like waiting for breakfast, lunch, and dinner.
Right.
And he's one of the lucky ones, actually, that has Wi-Fi. but others don't. And so
Wow.
that's how he's able to communicate with his family, you know, in one big blast, just posting a video.
Interesting. That's pretty cool. Yeah, 9:52, and so we're gonna actually end with this next clip here. This is just OMG, Bree.
Aw,
You know,
this is another one. Somebody sent it to us. It was a mother. Gosh, let me see if I can find her name. But she lives in Hawaii, their
Okay.
family. But she actually is originally from Guam.
Nice.
Daisy Maharlika. She went to school at Academy in
Oh.
Santa Barbara. And it's her son, Rizal, and they live in Oahu.
All right, and so this is a little inspirational video that the boy had put together.
Yeah, he did a rap. I think it's to his little sister. He says it in the beginning.
Okay, here we go.
I'm dedicating this song to my baby sister and everybody stressed out about the coronavirus. I hope you like it, and I hope you're not going to be stressed out about the coronavirus anymore. Some say the blacker the berry, the sweeter the juice. I say the darker the flesh stand, the deeper the roots. I give a holler to my sisters on welfare. Me no cares, don't nobody else care. And I know you like to be down a lot when you come around the block, brothers clown a lot. But please don't cry, dry your eyes, never let up. Forgive, but don't forget, girl, keep your head up. When he tells you ain't nothing to believe him, and if you can't learn to love, you should leave him. Cause sister, you don't need him, and I ain't trying to gas it up. I just call him her seal. You know what makes me unhappy? When brothers make babies, and we feel a mother to be a pappy. And since we all came from a woman, got our name from a woman, and our game from a woman. I wonder why I take from a woman, why I rape a woman. Do we hate our woman? I think it's time to kill for a woman, time to heal a woman, be real to a woman. And if we don't, we'll have a race of babies that will hate the ladies that make the babies. And since a man can't make one, he has no right to tell a woman when and where to create one. So would a real man get up? I know you're fed up, ladies, but keep your head up. Keeping your head up. Ooh, child, things are gonna get easier. Oh, child, things are gonna get brighter. Keeping your head up. Ooh, child, things are gonna get easier. Oh, child, things are gonna get brighter. Ayo, I remember Marvin Gaye, he sang to me. He had me feeling like black when he sang the beat. And suddenly the ghetto didn't seem so tough. Though we had a rough, always had enough. I huffed and puffed about my curfew and broke the rules. Ran to the local crew, and had a smoke or two. And you realize, Mama really paid the price she nearly gave for life to raise me right. And all lady gives my pipe drum, hard rock the mic, make it to the right speed. I'm trying to make $1 out of 15 cents. It's hard to be legit. I still pay rent. And in the end, it seems I'm headed for the penitentiary from friends, but they're blown in the wind. Last night, my buddy lost soul family. It's gonna take a man in me to conquer this sanity. He seems to rain or ever let up. I try to keep my head up. I still keep him getting wet up. You know it's funny when it rains it pours. They got money for wars but can't feed the poor. Say there ain't no hope for the youth, but the truth is there ain't no hope for the future. And they wonder why I'm crazy. I blame mother for turning my brother into a crack baby. What meant to survive? Cause it's a setup, and even though you're fed up, you gotta keep your head up. Keeping your head up. Ooh, child, things are gonna get easier. Oh, child, things are gonna get brighter. Keeping your head up. Ooh, child, things are gonna get easier. Oh, child, things are gonna get brighter. And Twatter laying 7 babies on the road. I know it's kind of rough and feeling all alone. Daddy's long gone, and unless you buy a lonesome, thank the Lord for my kids, even if nobody else want them. Cause you think we can make it a fact, I'm sure, if you fall, stand tall and come back for more. Cause it ain't nothing worse than when your son wants to know why his daddy don't love him no more. You can't complain, you doubt this. Hell of a hand, find a man feeling helpless. Because there's too many things for you to deal with. Dying inside, but outside you're looking fearless. While the tears are rolling down your cheeks. Cause the home sings all down this week. Cause if it did, you couldn't take it. And don't blame me, I was given this world, he didn't make it. And now my son's getting older and cold from having the world on his shoulders. While the rich kid driving men, I still try and hold on to my survivor friends. And it's crazy. It seems it'll never let up, but please, you gotta keep your head up. You gotta keep your head up, please.
his mom, Daisy Maharlika, sent that to us over the weekend. She's originally from Guam. She went to school at Academy in Santa Barbara, and they live in Oahu. Good job, Rizal.
Hey, you know, your kid's doing stuff that you want us to get out there. You got us all over the social media networks. Send it over. Hit us up in the DMs. But definitely a good message there. Wow, that was some...
Ooh, child, things are gonna get easier.
Yeah. He was feeling it there.
I was feeling it.
Yeah, I was feeling it too. And it was funny because yesterday when we talked about this, Bree was like, you know, maybe after we play this, you know, we can go on and we could do like a freestyle.
I was just kidding.
Yeah, I was like, okay.
You were like, yeah.
I was excited, but I ain't going to go after that kid.
I
know. Hell
no. We're good.
Yeah, we are. Bree, good job today.
Good job, everybody.
Remember, we're doing the governor's press conference. That'll be on our KUAM News Facebook page. We also throw it up on the radio. And are we streaming that on...
Always. Streaming on our Facebook page.
There you go.
We got to make sure everybody's informed.
Right. That's happening this afternoon, 1:30-ish. You guys know that they're pretty consistent about not starting it on time. So thank you guys for joining. We've done some things. We did a little mix with a mashup with the anthems and some local music to kind of just consider it your on-hold music while you're waiting for the governor to stroll in with her team. It's 9:59. Again, thank you guys. We're KUAM FM in Hagåtña, Guam. To our viewers on Facebook Live, thank you so much for all your kind comments and questions, and we see them and we'll ask them. Also, on our radio side, thank you so much for listening, 93.9 FM. The audio stream, Docomo Channel 10, thank you guys for watching there. Also, streaming on the KUAM News app and at KUAM.com. And last but definitely not least, to our viewers on KUAM TV 11. Thank you guys. Remember, we throw the show up every back half, 8 to 10 a.m. on KUAM TV 11. Bree?
You sure you didn't forget anything?
Is that everything?
Yeah.
Yeah, because we got to go all the way till exactly at 10, so I'm kind of...
No, really, just thank you all for tuning in, watching, listening, and also thank you to all of our frontline heroes out there keeping our community safe and everybody, really. I mean, people, just by staying home, you're doing something. So thank you.
Hey, we got the power to kill the curve. It is Monday, the 20th day of April. I started the show with this. Want to end it with it, too, man. It's my late party, Savage K, with a little 420 jam for all you guys out there. Sabrina, good job.
Good job, Christopher.
And you guys, thank you.
And Joe, sir.
And Joe, sir, of course, Ken Sanity. That's it, Pansit. Thanks for watching Containing COVID. Walhus and Chris for Sabrina Esta. Joe.
Bye.
Be healthy. Be informed with ITD.